channel Rio Grande Seer and the Facebook page Rio Grande Seer. Recently, I have been asked why I am doing this. I started this project as a service to the community. I felt that having the Rio Grande County Commissioners meetings put out on YouTube would let people be better informed on what was going on. I'm not doing this with any ulterior motives. I have started to do interviews and more reporting than just commissioner meetings. I endeavor to do this as fairly and without any bias as I can. I do recognize that we all have our own biases, but I am doing the best I can to make the videos I put out to be as fair and unbiased as possible. Thank you for watching my videos, and please subscribe to the channel and click the bell to get notifications when I go live or when a new video is put out. Hello, I am Justin, and I run the YouTube channel Rio Grande Seer and the Facebook page Rio Grande Seer. Recently, I have been asked why I am doing this. I started this project as a service to the community. I felt that having the Rio Grande County Commissioners meetings put out on YouTube would let people be better informed on what was going on. I'm not doing this with any ulterior motives. I have started to do interviews and more reporting than just commissioner meetings. I endeavor to do this as fairly and without any bias as I can. I do recognize that we all have our own biases, but I am doing the best I can to make the videos I put out to be as fair and unbiased as possible. Thank you for watching my videos, and please subscribe to the channel and click the bell to get notifications when I go live or when a new video is put out. Hello, I am Justin, and I run the YouTube channel Rio Grande Seer and the Facebook
Work session. We're waiting for Tony to get here from whatever. She's going to come in and give us.
Because she was getting some other stuff set up, and then she was going to send me the IGA on the with the towns, and let me look at it. Maybe I can run Ryan down, and we can. Hey, can we have it no later than Wednesday so we can start acting on it and then go?
You're talking this Wednesday or the next one?
Next Wednesday.
Okay.
Your regular meeting. That if we can pretty well have it, that you can vote on, and if you know if he has to run back and make some changes, then you can still have it voted on and you can sign it.
And I don't know who does this, but internally, we need to be thinking about how we want to structure that. Do we want to hire somebody for that? Do we still want to sit downstairs? Do we want to have a separate person?
Well, that's the other thing is I might, just say, okay, if we take the directorship, interim director out and you just do these grants and you give us exactly, okay, then we'll have to see if we can find somebody. But I think that right now it might be, I don't know if the accountant has anything in there for grants. I just really need to sit down with Debbie and Bobby to also have some time to work with them to see how we distribute the responsibilities here between the administrator, accountant, HR, and Bobby.
Well, we've asked for that before,
Okay.
Particularly the former administrator. How do you want your office set up? How do you want the duties?
And I have an organizational chart that I'll probably just scribble out and give it to you.
Good.
Not pretty because we can just move those things around and see if we can sort of get an outline. So when you start hiring people, they have a general idea. You answer to this person or that person. I think that'll make things a lot
If we can
easier.
to me, that's pretty basic. Personally, I think it can be done fairly easily.
Right.
Some of this other stuff, particularly the CBRF grant funds, probably need to be handled almost all along, separately.
Yeah.
To make sure we don't have the duplication and we don't see the funds misspent.
Yeah, and it's a cleaner, this person is responsible for this and this, and this person does this.
And it's big enough and a short enough time that we really need to have
Yeah, we
somebody
gotta
on.
move on that one. So if you need me, yell at me. Otherwise, I'm gonna see if I can even get signed in as an employee. So, and a few other things and some phone calls I have to make, so.
Okay, thank you so much. Okay, Gene, we've already talked about the need for a vehicle for the emergency manager.
Yes.
And we'll take our next steps on that, whatever that looks like. Is that right?
Yeah.
And that was the only thing that you had today for us?
That was it.
Okay. And then the rest of the time is devoted then to Tony, as I understand. So,
We need to
when you're ready to go,
Suzanne,
Tony,
can you
we're
hear
ready to hear. You have to look at this.
Can you hear us?
Yes.
I didn't see you were muted. I just tried to make sure it was. Can I put this down there a little bit? This would be better for you.
Do you want to let me in the meeting? It'll be easier for me to know who we're talking to.
I'm sorry?
Okay. Bobby?
Oh, sorry.
You're in the meeting. At least you're on Zoom.
Do we have to let her in the meeting?
Oh.
Yeah, it should pop up right there. So you say allow.
Admit, Tony is in it.
She was
Okay,
clicking
Tony,
away.
you're in. Mute your volume on that.
I thought I did. Okay.
And tell us what,
So I kind of thought that you'd both have your laptops, so we might need to do some printing.
some of this I can do on my phone, but not well. And Tony, logistically, if everybody in here's got a computer and they're logged on through the county,
Mhm.
we lose our bandwidth.
All right.
Okay, here's your email.
So, some of it. That's not going to let me get it. Okay. So the email that I sent you has a bunch of links in it. I do apologize that I wasn't able to get all of that put together over the weekend. I did try, but I had to leave town. So your email has things that are kind of numbered. Did either of you get the email?
I'm looking at it right now.
Okay, perfect.
And that came in
Just
just
ahead of the
a few
meeting.
moments
Yeah.
ago. Yeah.
So you'll see that I have things numbered. I'm not particularly concerned about the numbers on there, though. If you want to go out of order, I'm happy to do that. The first thing that I was going to visit with you guys about is some of our staffing changes and updates. You know, we've made quite a few changes over a little bit of time. So I just wanted to check back in with that and let you know how it was going.
Go ahead.
So our COVID response coordinator position, that's going well. We need to, actually, I think we're doing a lot better already this week in getting that line of communication
Who is it?
to her. That's Ida. So she is answering mask complaints. She's answering just general requests for information around COVID, around our local orders. I do need to add the variants to our list, so we'll come back to that. What the requirements are for businesses and individuals. So all of those kind of questions are funneling into Ida. So we have one person. There are some specific questions that I've asked that she makes sure that I'm CC'd on and that I have information on. So if we're having those conversations somewhere else, I can go back to it and know that that's what we've told them. People who are calling for guidance and advice around events are having we're having some miscommunication there. So I can actually hear Ida while she's on her phone calls, and we've been accused a couple times of telling people they can't do things or telling people they need to shut down. That's absolutely not happening. That's not what we're after. We're trying to provide guidance and interpret that guidance that comes from the state to our local area. So we're not approving or shutting people down for events, their business activities, or anything like that.
So some people are under the impression that we're doing that.
Mhm.
And so that's the source of the calls.
Yeah. So
Like we got a rumor that we were shutting down the fair. for
Right.
instance, and it wasn't true.
Right. So we don't have any intention to go in and shut things down. We want people to abide by the guidance as much as we can, as much as is realistic. And then we're going to have an interpretation of that guidance, and we'll let you know what we have. She's delivered quite a few masks and tried to really be positive about what's going on with that, especially since we have another 30 days now that the mask order has been reissued. So we've
Just been extended.
Mhm.
Okay, and how are we delivering masks?
Ida will deliver them.
To
If somebody calls and has a question about their event and it seems like there's some confusion or maybe some just bad feelings around the guidance that we have, she's trying to reach out personally, and part of that is, can I bring by some masks in the morning to make it more of a positive interaction? Then you must wear your mask or figure this out yourself. So we're trying to be a little bit proactive and reach out to them and show them that we understand it's difficult. It's really hard to follow these orders.
And that's Ida that
Mhm.
does that. Okay.
Yeah. So she's doing a great job with that. She's got great language that she's using around encouraging businesses and trying to be supportive rather than doing kind of enforcement or really going back to the codes. We want to encourage people and recognize when they're doing well. That's something that we're going to start up this week, is looking at those businesses that have been really following close to the orders and have been paying a lot of attention to how they can get through this the best they can. So we're going to start sending out some notes and just generally letting people know that we do notice the good things as well. We're not just the mask guys.
So that's Ida.
Yep. So Ida's doing real well.
Okay.
Our public health nurse, the second public health nurse, has come on. That's Amy. And
when did she start?
She started last Monday. She's done quite a bit of training. The public health nurse positions require a lot of training on the front end. So for the immunization training through the state, you're required to do all that. And she's doing the FEMA trainings, so she can help with EPR, and that's actually a requirement
What's
for everyone.
EPR?
Emergency Preparedness
Preparedness.
Response.
I can understand emergency response or emergency preparedness. What's preparedness response?
That's what they call it. That's all I got for you. So she's doing a lot of those trainings. She's doing very well. She's going to look at specifically the travel clinic is something that we don't have right now. So if you want to travel out of the country and there are specific immunizations that are required for where you're going, we do that for the region.
Except no
And
yellow fever, right?
we don't have that right now.
Okay, and and you say that's not functioning right now?
Right.
So people have to go to the medical
We
facility.
can't actually leave the country for very many locations right now. So it's not been, we haven't gotten a lot of calls on it.
Okay.
But we're getting that set up. So once people can start traveling again, hopefully we'll have that service in place and she'll have her trainings done and her certificate. It's fairly simple and she can do it from here. So she doesn't need to travel for that. She's also going to work a lot on our tobacco programming. So
And
the
what does that mean?
state tobacco education prevention program.
Okay, and we've got 2 of those, don't we, at least?
So Baby and Me Tobacco Free is a separate program, and that's Diane does that herself, and that is a fairly minimal program that we have. We have the regional STEP program, which is that state tobacco education prevention program. We have that, and we hold that for the region. So we actually subcontract. You guys just signed these, I think, at the last meeting. We subcontract the other counties.
So we have an IGA or
we have
a
contracts.
fiscal agent.
We have contracts in place for the work that they're doing. Yeah. So she's going to do some of the meetings. She'll do some youth support. They do things like you saw. Paul went out and did the tobacco T21 programming, which was trying to get local areas to move their laws so that you'd have to be 21 to purchase cigarettes.
Mhm.
And now that, of course, has been, that's everywhere. But
Statewide.
we were pretty successful with it when we were trying to do it locally. So she's going to take on that
But
role.
that's been taken care of by state regulation, right?
The T21 specifically.
Right.
Yes.
So you don't have to worry about that one anymore.
No, but the tobacco usage, especially vaping, is still increasing in our area. So we definitely want to keep working on prevention as much as we can and providing alternative activities, because that's a strong way to encourage kids not to use
When
these
we
substances.
when we're talking to Emily about that, we asked specifically, are there any metrics of success? How do we know that any of these programs are meeting any kind of a goal? Do we have a way of tracking that? And
Mhm.
basically, her answer, as near as I could tell, was no. Is there a way of measuring the success of a program like this?
So for these programs, it's very long term. What they're going to use to measure their success is 2 things. So you're going to look at overall, over a long period of time in different areas with different demographics, how successful are different programs. And then you're going to look locally. We have the Healthy Kids Colorado data that breaks down specifics to our area, to individual schools, and it breaks down the behaviors for the students. So have you smoked in the last 30 days? Have you ever smoked? Those are questions that they're going to answer. And we continue to have increases in that.
Okay, so you have some statistics that show that the use is going up.
It's being sorted through now. That's one of the things that the CTC, Communities That Care group, will do. They bring these data items together and then they'll kind of analyze them for our local areas. So the school specific data isn't released just to the general public because our schools are so small that there's a concern that some of that would be identifying information. So CTC has agreements with the schools to be able to go in on that closer level to get a more specific look at our area.
Okay,
So
I'm going to ask
data.
another question, because some of this stuff is things that were never clearly explained. I've received complaints, even
Sure.
in the building here, about the number of acronyms we use
Mhm.
and what do they really mean. So Communities That Care,
Mhm.
that is funded through what?
CDPHE, Colorado Department of Public Health and Environment.
Okay, but under what program?
It's our CTC grant.
It's the Communities That Care grant.
Yep.
Okay, and it's funded out of CDPHE. Is that tobacco money, tobacco tax money, or is that separate?
That's separate.
Okay,
This
so it's separate from tobacco tax. Then we have a tobacco cessation program that's funded out of cigarette sales tax or cigarette taxes.
that is where it's funded through, but it's,
That,
think
that
when
this
you say
particular grant's funded through that?
program,
The CTC tobacco. portion-
CTC is not
Part
funded
of
through
tobacco.
tobacco.
So there's another
Right.
tobacco source of funds,
So STEP, State Tobacco Education
STEP.
Protection Program.
okay? And is there an
That's-
overlap between STEP and CTC?
No, there's cooperation between STEP and CTC.
Okay, and
For
and
instance, that
State
healthy
Tobacco Education Program,
prevention.
prevention.
Mhm. So that is our funding to work on tobacco issues. It's not a specific program. So when you say program, if we had something like CTC that we were funding through these dollars, then you'd have a little bit more of a matrix that you could go off of to say this is this successful or not. These are funds that were recovered through the tobacco lawsuits, and they're being used to address tobacco issues in the local communities. So those funds are being brought down, and then we decide what to do with them.
And what are, well, I
This
don't want to
isn't
get you off
a
your schedule,
program.
but what are we doing with the STEP money right now? How are we executing this program,
So
our program?
sure. We have connections with the school. We're working on bringing programs into schools that are less punitive and more rehabilitation kind of around smoking. So if a kid gets caught vaping, it's not really likely to stop them from vaping if you suspend them for it. But what we can do is do the second chance program, or one of the programs that can be done in the school where you actually sit down with the kiddo and you have conversations with them and you work through kind of what their motivations are and what the actual concerns are and what else they could do and what programs are available, what help's available to them. So if you do that, you're more likely to have the kiddo stop vaping than if you
And there's
suspend them.
statistics that support that.
Yes.
Okay. And when we do that, is it one of our public health department people that go and do that, or do we coordinate with the schools?
So what we're doing there is we're having the conversations with the school to do that program. We're not running a program.
So the STEP program, when we get however many dollars that come in, you're having a conversation, primarily you're looking at youth right now, as far as prevention and.
So
reduction.
prevention is much more successful with youth. So a lot
So-
of our prevention dollars do go
so-
that way.
So a lot of the money goes to that effort.
Mhm.
Does the school receive any of this money, or is it money that we fund in, that we use internally to send somebody out to talk to schools? How does that work?
Yeah. So really this would be part of their wage, is that they're using their time to go and talk
Okay.
to the school.
And how does that, you say we cooperate between the communities of care people
Mhm.
and STEP?
Yes.
And who's our STEP person?
That's going to be Amy.
Amy,
She's
as a
training.
nurse,
Hmm.
is training for that. Or
Right.
for this. Who was it prior?
Paul.
Paul was doing it before.
Hmm.
Okay. And then Paul was doing other things also that were also funded by some of these variety of grants that we have.
Yes. So he was also doing immunizations. He was doing, he would help with CTC occasionally. So he may lead a conversation during a CTC meeting that had more to do with tobacco. That's the regional group that comes together. That was the first one that we discussed. So if there's a tobacco specific issue that needs to come to the community, that's a good place to start, as you bring it to one of those meetings and you share at the meeting, and then they have an opportunity to bring that information even farther out. If we need to analyze some specific data or look through something that's coming down from the state, we can also do that through the CTC meetings.
Okay.
That provides an opportunity. A lot
Okay.
of their cooperation is through that data analysis and doing that at a community level.
I'm sorry if I seem like I'm taking up time. I was trying to figure out the staffing and who's assigned to what.
Yeah. So one of the attachments that you're probably gonna find a little bit difficult to look at on your phone is
Now, I don't see any specific links on mine.
on the bottom.
Oh, down there. Okay.
Yeah, so public health grants overview staff. That kind of is a breakdown of the percentage. each staff member is going to be paid from some of these different grants. So Amy's going to do immunization, travel. She'll be getting some of her funding from our core services funding that comes in. And she'll be doing a little bit of the COVID response as well, because that's something that needs to just be shared out around the whole office. Everyone needs to be getting that information, staying current on what is going on. We need to be staying current on our local information and our local guidance and orders. And they also need to be able to answer general questions from the public, because that's what our office is here for right now.
As I understood it, one of the reasons we needed the nurses is you needed a healthcare professional specifically on that first contact. That's not the case.
No, so we have Diane to back up. So as we discussed at that meeting, Ida is an LPN, so she does have some medical history. So she's someone who's working on that. Amy's position came in to back up Paul, to cover the things that he was going to take the place of Paul, cover the things that he would have been doing regularly as a public health nurse.
Okay, so
So we
when
needed
Paul
to
became the
replace
public
that.
health, interim public health director,
Right.
that created a void
Right.
on the professional nursing side of things.
Mm-hmm.
And so we needed to hire to fill that position specifically. But as it was explained to us,
Mm-hmm.
that for contact tracing,
Mm-hmm.
for the follow-on contact, we could use any staff member if they had some training and a script, so they could do the contact. That was what was explained to us.
Yeah, so I know you had that conversation before I came on. When Diane and I sat here, we had a conversation where she also agreed that Ida is a great contact for that.
Right.
She's got great experience. She's
But we had
got
talked
the
in
background she needs.
we had talked in overall concepts. How does the department work in response to COVID?
Mhm.
So just to recap, when Emily left, there was some confusion about who was doing what and what the needs were in that department.
Sure.
So we had Paul come up and we talked to him about, tell us what you need specifically to respond to COVID, because that's the big issue in front of all of us. And he told us certain things and he told us how it would work. But what we were told specifically is that initial contact, because of HIPAA concerns and all of this, privacy concerns, and the types of questions that were being asked, that we needed a public health professional for that purpose. And that for the follow-up contacts, for contact tracing, anybody in the office could do that. They didn't have to be a medical health professional, as long as they knew what to ask and how to track that. So that was what they were going to do, because he was complaining that 50% of both of the nurses' time was on this follow-up contact tracing. They were losing half their time to doing that when they were afraid that the outbreak, where they have all these new cases potentially emerging, they needed to focus on that and not making the call 2 days later to do whatever the contact tracing looked like at that point. So we based our decisions on that and gave him full authority to hire whom he needed to, is that right, Gene? We gave him full authority to reassign tasks inside the office. Full authority. Do what you got to do to deal with COVID. And at that point, you came up, allegedly, you came over to the administrative side to take that grant administrative burden off of Paul so he could focus on COVID. Now, I know there's more to being the public health director than just managing grants and dealing with COVID as a nurse. I understand that. But it was not made clear to us by any previous public health official exactly what they did besides go to meetings. Okay? Now, they probably did more, but they never told us about it. All right? So we were giving them full authority to do what they needed to do. But we never understood, it was never apparently clearly explained to us why we had to have an RN or whatever the minimum threshold was for this initial contact with the COVID patients, the positive cases.
Right.
I'm not sure now if that was required or not, based on what you're telling me. But if it was, we were freeing up those public health nurses to deal with that. And we were freeing up all the other staff to be reassigned as necessary.
Mhm.
And as I understand, most of the staff was either working from home or staying at home at that time.
Mhm.
Is that correct? And some of these programs weren't getting a lot of attention because of COVID.
Right.
For instance, immunization for international travel.
Right.
Okay, so those things are still in the basket, but they're not being utilized right now. That freed up time to deal
Mhm.
with COVID. So we trusted the public health director to use the resources efficiently and tell us if they needed more. And that was the whole thrust of all of those conversations starting back in February.
Sure.
Okay. And somehow it just turned into a cobbled up mess down there during that period of time. At least we never got clear answers to how it was working. And,
Sure.
And we were having trouble getting clear numbers on, do we have new active cases? Did we have 3 cases last night or 3 results come in? And the results were coming in so late.
Right.
Paul told us that some of the positives, when they finally got here,
Mhm.
that person was already out of isolation.
Right.
And was no longer on the active list. And so we weren't getting a good enough, I want to say filter, but you got to filter the information so that you know that this result that came in is old news.
Mhm.
We no longer have that person in the system. And we weren't getting that. We were just getting these aggregate numbers, whether they came from the state or regional. We didn't know, we weren't told. Okay, so we were asking for, give us numbers we can work with as the Board of Health, because we have to be responsive to whatever is happening. But we don't want to be making bad decisions based on bad or stale dated information. And so that was what we had asked of the health department.
Mhm.
And you were given the job of take the grant load off, make sure all that's being taken care of. And you found some deficiencies there and things you had to work through at
Mhm.
that point, like we hadn't requested reimbursement and what have you.
Right.
For a period of time. You were working through that. So I got a little confused as to what's the problem. It sounds to me like you've got some things lined out now, particularly COVID. If you have one individual there who's fielding the questions from the public,
Mhm.
and you're calling that person the coordinator,
Yes.
okay?
And she's also our primary contract tracer. So if she gets to a point where she has too many cases, or if there was a case where there were too many people to contact around them,
Mhm,
she is able to then call down to the next person
mhm.
to be available. And we have 3 people who are available and we're not using for contact tracing because
The
she's got it under
caseload's
control.
light.
Yep.
We have very light caseload
So
right
that
now.
could increase, yeah. And
Schools
we're
open
prepared
up,
for it.
whatever, you're prepared.
Yes.
So right now, you've got your department structured in a way that it can respond to
Right.
some outbreaks.
Right. So we're not going to be able to fully respond. If we had 50 cases that we're calling on in one day and they're new cases, we're going to have to reach out. Our first step is going to be a regional reach out, which is going to include Valley-wide Health Services is now doing some contract tracing. And at that point, once we exceed our regional capacity, we will reach out to the state.
Okay.
And they have some measures in place where they would come in and they would assist smaller counties with those issues.
And you're talking people and phones, basically.
Yeah.
Okay. Then whenever you get that information from outside the county, from other sources, let's say regional takes over part of the load, or
Sure.
the state takes over, how does that information get to you?
The contract tracing information, just the number of people that we're contracting or any of it?
I don't know exactly what information you need, but when you come to the Board of Health and they say, we've got a problem coming up, you need to
Mhm.
be able to explain to us what the problem is and where the problem is. So
Sure.
we can adjust. If it turns out that, I'm gonna use as an example, don't anybody get crazy with this. RV parks.
Mhm.
We have an outbreak in RV parks. Okay. At that point, Board of Health needs to step in and start doing something in terms of policy working with you or whoever the public health director is and issuing new orders or whatever we have to do to respond to that.
Mhm.
But if it comes in with a blanket number of Rio Grande County has these many new cases,
Okay.
and it sounds like it's spread out across the county when it's really one site.
Sure.
Okay, but we weren't getting that information before. So my
Right.
question is, whenever you're working with outside people because of the overload,
Sure.
how do we get a smooth, accurate, real-time flow of information back to this office in the county?
Sure. So our positives are going to come from the same place they're coming right now. We're actually going to get that data from the hospitals. It's also loading up on to Cedars, which is the shared, I don't know if that's an acronym or if that's just what they call it, but that's a shared database where all of these outbreaks and other outbreaks that aren't COVID related,
Cedars is a state program.
that's going to go on there. Yeah. So what happened early on is that Cedars was taking a really long time to get those positives. So the regional group came together with Rio Grande Public Health, and they all agreed that they would take their data from the actual testing sites, so from the local hospitals. So those positives were brought together onto a sheet that is shared among all of the entities, all of the related entities, and that is what we're using for our positives, for our new positives, our active numbers that we're sending to you.
So you're not getting it reported directly to you by the clinics or hospitals.
We are.
You are,
Yes.
but you're using Cedars.
So that's still being used because they also have to report to that.
Okay,
But
so
when
you
we're
got side by side.
reporting our active, we're reporting off of our actual local numbers that we're receiving from our positives from the hospitals. So we're not waiting.
You get real-time data or
Right.
near real-time data.
So that's still there. We're still comparing. We're making sure the data matches up, but we're not waiting to see when things pop onto Cedars. We're reporting off of the actual positives. So that was a response to that lag that they went ahead and moved forward with just to make sure that we had the most up-to-date data we possibly could. Outbreaks are somewhat, they're defined more specifically down to the industry that you're in. So a long-term care facility outbreak is defined pretty specifically. If you have 2 residents, then you need to start reporting up the line to that you have an outbreak. So that the outbreak protocols are somewhat different than the just individual case kind of protocols. And in the case of an outbreak, we're reporting that every morning. So if we were to have an outbreak, we would now be reporting that when we're talking to the regional group, and we would bring that back on our regular reporting.
The
We don't
regular
have
reporting that
any-
you send out to
right.
us.
We don't have any outbreaks at this time.
An outbreak is 2 or more.
In the long-term care facility, it is specifically defined as that.
What about a workplace?
I will have to get that specifically, but I know it's not more than 5. I think it might be 3.
But there's a fairly low number, but if you have multiple
Yeah.
cases at one site, now we've got an outbreak.
And there's also an EpiLink, which is that there is a demonstrated tie between one case to the other.
Okay.
So
An
if you
EpiLink, epidemiological?
Yep.
Okay.
So if you have 2 people who are in the same workplace, so if I got COVID and someone in the sheriff's office got COVID and we had never crossed paths and there was no reason for us to assume that they had come together, those wouldn't be counted together for an outbreak. There would have to be a link and the number. So we need to be able to show that this is because of these people coming together that this has brought on an outbreak. So that contract tracing that would come from outside of the region, if it came to that point, that would be reported through Cedars.
And
But
it
at
might be
that
a little
point,
bit delayed.
We've got such a huge issue that going in at that point, if we had that problem, we would be going through each individual and we would have layers of help to make those links and see if there are connections that we need to be aware of, because we do want to keep an eye on outbreaks. That's going to be a really big thing that we want to make sure that we don't let that continue to grow.
Yeah, you don't want it to get ahead of us.
Yeah. So
So-
that is important, and there are policies and there's procedures in place as far as the contract tracing itself. And all of our staff who are doing contract tracing, they're actually separately trained and had to do certificates for that contract tracing.
Okay.
They're not just trained in-house. That's They don't have a script that they're just reading off of. They need to learn the skills. They need to learn what they're looking for and how to ask the appropriate questions. So that's what they're doing. I'm not sure. I think what I can understand is that there was a hope that we could have a medical professional answering those early calls because people were really looking to us for medical advice, where some of that training is actually helping to make sure that we're guiding people to appropriate medical advice and to their practitioners, and making sure that they're following through on taking care of themselves, not just at home. Make sure you're taking your temperature and constantly checking and making sure what your symptoms are. But also, if you feel like you need to reach out and you don't feel safe or you don't feel like you're getting better, you need to connect to somebody who could really help you with that. Not public health. That's not what we do.
So you're an information source.
Yes, so that's a lot of what public health is. We're educators. That's a big goal. And in this COVID response, that needs to be a big part of our goal too, is that we get information out, we connect people, and we educate. So that's our goal. But
I think I got you a little off track here.
so
But
maybe we'll do
it's,
some.
but it's all kind of related.
Mhm.
And as you're talking about how you're allocating your assets, your people, your personnel,
Mhm.
it does go back. COVID is really driving just about everything right now. But you still have to maintain not just your core function, which is another question,
Right.
but all of these programs that we're responsible for.
Mhm.
Okay, so
we don't want to let
it's a
stuff
management issue.
fall off
Right.
because we're not doing it.
Mhm.
And everything's going to tie back to COVID right now. So part of STEP is educating people on what are the additional risks if you smoke on top of COVID. What does that look like long term? The recovery rates for people, they may be recovering, but if they were smoking beforehand, there's a larger instance that they may have long-term effects from the COVID. So we want to make sure that we're educating people all the way through the process. And COVID gives us an opportunity to remind people this is one way you can take care of yourself. And even if you're talking about average illnesses, if you're smoking, you're putting yourself at a higher risk. So we keep having those conversations, and that's part of what we'd like for Amy to be doing, is she'll be coordinating and making sure that we get information out. STEP also does a lot of, we do some advertising, we do regional prevention events, those quick kits that you'll see, the little bags with the information in them. Those are, it was Quit Kit, and
This is
they're,
on smoking?
Yeah.
Okay, so that's the swag?
there's some, yeah,
The-
it's a little
the
less
pop sockets
swag.
for the phone?
It's a little less than that, but I mean, there's some. And sometimes it's a toothbrush, or it's a lot of brochures, a lot of information. Gum, Tic Tacs, those kinds of things have gone in there just to really keep it fresh in your mind. So if you go to an event, like if you had a fair or a farmer's market or something, and you could pick up one of these quick kits, hopefully it stays in your mind and you can go home, think about it a little while, and then call and make a great decision to no longer smoke. That's a super great decision that people ought to make.
Okay.
Yeah.
Yeah.
So Amy is on, and she's actually doing really well. She's knocking through her trainings pretty quickly.
Great.
Yeah, so we're excited about that. We do still have another nurse position open, and if we were able to fill that part-time or full-time, we would use that for some more of the COVID specific response. Right now, we're not in a dire need for that service, and we are not getting any applications.
That was a spot where we were going to look at maybe a part-time or half-time spent in nursing, and
That was going to be real COVID specific, and once the COVID funding was out, that position would be finished.
So that might limit your applications in short time.
Potentially, but we're not getting a lot of applicants for much. And while we're probably getting fewer than other places, it's hard to hire in public health right now. Because it's a difficult area to be working in. Everything's up in the air. You don't know what your job's actually going to be, and there's quite a bit of hostility. I've been called some real fun names just in the last couple weeks. So
And that's that's not just Rio Grande County, that's a kind of a national
Yeah.
dilemma.
So hiring in public health is
Overall,
it's hard right now. Yeah.
Okay.
So I'm not.
Thank you.
I'm
So
not
you'd
sure
like
how
to have
get us.
another nurse on board, but you're, right now we're not getting.
I think we have room for one. If we wanted, if we needed that additional COVID response. Honestly, I'm not really worrying about where we are for our level of nursing right
You're
now.
gonna continue to look for one just to be on the safe side.
Yeah.
Everybody's got this big paranoia. We're gonna have a major
Right.
blowout this fall.
So
Okay.
we would be ready for
So
that.
be
And
ready
that
for it.
person would do a lot of COVID and emergency response and just training and getting ready to step in.
But you only have 1 or 2 weeks to do that, right? Before the potential threat. Because the next event is
Anytime.
potentially school openings.
Yeah, I mean, that depends on who you're listening to and where you are on the data. It's really going to depend.
But we don't have anybody
can't make a good
in line anyhow, so
Right.
we won't be able to respond in 2 weeks, for instance. I mean, we can respond to what we have,
that. Yeah,
but if you really had the
right.
need for that,
We couldn't get
we're a
them
little bit
ready.
behind. Okay.
Yeah. So, I mean, I don't think it's a bad idea if somebody comes along and we still want to try and fill that, but I'm not worrying about that. That position isn't keeping me up at night. I also wanted to update you that I went through the overtime payments that we had made for 2 of our staff members.
Mhm.
There was a bit of a misunderstanding, which you'll see on there. They are titled by the individual's name and then payroll summary. And then I also included the memo that I sent up to Human Resources, which is right now just everybody up here. So what I found was that for one of our nurses, the time had been compiled as anything over 35 hours a week we paid out as overtime. And that's not actually how we do that math. So anything between 35 hours and 40, I requested that out as straight time. And then overtime, we
Over
just
40.
did the math on that over 40.
So, but if they were working 35 hours a week, let's say that was a
Mhm.
normal work week, and now they're working 40 hours a week,
Mhm.
that additional 4 hours or 5 hours, whatever it is COVID related. That's why they're working more hours, right?
Probably.
Okay, but that is an unbudgeted item.
Yeah.
And so therefore, by statute, eligible for COVID reimbursement.
Yeah.
So are we tracking that? Was it a 214 we tracking on or something like that?
Yes, but we also need to have a conversation about that too, because at this point we don't have any wages that need to be recovered through FEMA. We're paying our wages through our grant funds, through our funds, including our CARES Act funds.
Even though they're working on COVID related events.
The funding has been freed up to pay for COVID.
Okay, so we have 2 sources of funding for the same effort, potentially.
If we were to charge to FEMA?
Well, you have the grant, the original grant, which they relaxed the requirements, so you could take that money and use it for COVID personnel.
Some of it, yeah.
And FEMA said, or I guess it was FEMA that said under the CARES Act or whatever, that anything unbudgeted, extra time, what have you, that wasn't in the budget originally,
right.
could be attributed to COVID. They could respond.
Right.
So if you can take, let's just say, I'm just going to pick a grant,
Sure.
CTC, the Communities of Care grant,
Mhm.
and Ida works an extra 10 hours a week for some reason. I'm just picking
Sure.
a name and anybody.
Right.
Joe is working an extra 10 hours a week.
Mhm.
Just because that grant says you can use our money for COVID,
Mhm.
it was never in the line item to even work that extra 10 hours.
Mhm.
So now we're having to move money from whatever it was allocated for in this grant to labor, to personnel.
Mhm.
Whereas FEMA has already authorized us to use FEMA funds for that same 10 hours of work.
So CVRF, if that's the one that you're referring to, is not attached to FEMA. So for FEMA right now, we're still just anything that we need to put on there, we're just recording, and that'll.
Oh, I'm
that'll
not talking
come
about
later.
CVRF money. I'm talking about
Okay.
any other money that was available before CVRF was even
Okay.
announced as being distributed. As I understood it, there was money available for public health departments to
Right.
pay for unbudgeted expenses that were incurred as a
Right.
result of COVID.
Yes.
It got complicated whenever some of the existing grants said we're going to include COVID as an eligible expense.
So it's somewhat complicated. Some of the grants that freed up their funding did so understanding that the staff that they had been funding and the projects and programs that they've been funding were all diverted to COVID.
Right.
So you weren't going to be able to spend that down anyway. So some
So
of
they
them did
said,
that.
now you can. We're just going
They-
to add COVID as an eligible expense.
They went through the process. They got permission
Mhm.
to use those funds for COVID.
Sure.
And so they freed that up and they let us know. What happens then is, so you picked CTC, and we did put some of our COVID funding into CTC. It was funny that Ida is the only person who wasn't on that grant, so we didn't put her onto any of it. But we did spend down some of CTC with COVID expenses.
But
So
we
we
didn't put money
push-
into CTC. We took money out of it for
Right.
COVID, right?
Right.
So no money moved into CTC for COVID.
Right.
Money moved out of community of care for COVID because
Right.
it is now unauthorized expense.
Right.
Okay.
So
But if it was overtime, unbudgeted, how did we account for that?
So our accounting, our backup documentation is the same, but the COVID expenses allowed, that was allowable. There's nothing preventing us from using the money that had been freed up for overtime on the COVID response.
Okay. Gene, are you following that? I mean, it's not that you're obscuring anything.
Yeah, I think it's basically you can use it for both,
For any time.
any time at all.
But what I'm losing on this is the grant's only this big.
Right.
Okay. And in there, you have so many hours of time,
Mhm.
staff time allocated.
Mhm.
Now the staff is working 20% more.
Mhm.
Where does that money come from?
Okay. So
You see what I'm saying, asking?
the way we reported on COVID spending for CTC, for instance,
Mhm.
was that the staffing lines stayed the same. We didn't invoice COVID out of our staffing section. Most of these invoices have an other section. And what they asked us to do was to break down each individual and the amount that we were charging for COVID response in that other section.
Now, the other was presumably earmarked for some other expenditure. Other isn't necessarily staff time. It could be
Sure.
anything.
So we were meant to go to a conference, for instance.
We're not going to the conference.
Can't go to the
right now.
conference. So we're moving those funds down. If Nancy spent 2 weeks working on COVID rather than working on CTC, that money wouldn't have been spent down in the payroll anyway.
It would have
So
been spent
those
out of
funds
other.
were freed. So we spent out of other for some of those expenses.
Some. I'm assuming other isn't that big a chunk of
It
the
hadn't
grant.
been. So when you need to move funds, so a significant amount of funds, our approach is that we will then contact the program manager and we'll ask them if this change is allowable. They'll consider it on the allowable, reasonable. They'll
Right.
make sure that it's fitting. And then they can send that back to us and we can actually change the numbers on our budget at that point.
So in effect, what we would do in the county on our county budget is we do supplementals when we have to
Right.
make major shifts like that for whatever reason. How do you track the change? We have the original grant and the original budget,
Mhm.
and then it's changing periodically as we respond to COVID.
Right.
Is there a step-by-step tracking of how that money moved?
So what we track is actually that allowance. So in this case, we didn't have to reach out to the state. They reached out to all of the CTC programs. So they sent their allowable and their requirements in an email. So we have that document that goes along with our paperwork. And then our invoice is going to demonstrate where that change happened. So we didn't change our actual budget with the state.
Stays over
We
there.
have permission to change our charges.
I understand
So
that.
our next month's invoice is going to show exactly where the spend down happened. And we have that tracked.
And
with
how are
the
we
backup.
tracking our expenses versus the anticipated reimbursements? I guess what I'm saying is there a potential to overspend the grant when we do this?
No. So we're invoicing each month.
Mhm.
And we have that tracker on there, even on the actual grant document. It's got how much is remaining, how much has been spent year to date.
Okay.
So we invoice to the state only as much as that grant total.
Mhm.
So we're doing our final invoice now. We're actually working on CTC today to get that closed for the year.
Because that closed in, what was the fiscal year on that?
June 30th.
That was the June 30th.
Yes.
Okay.
So your June ones, they tend to run a little bit late because you want to make sure that anybody who was invoicing for June, and it has time.
Yeah,
to
you
come in.
got some tail on that.
Yeah.
Yes.
So we're doing June and July at just about the same time for that reason.
So you're doing closeout and beginning the new fiscal
Yeah.
year about the same time.
And that's fairly standard. We're probably a little longer than we want to be, but we're working on it. So that is actually going to be zeroed out, or we're going to have to send a little bit back. If we had to send a little bit back, it would be around those $5,000 stipends, which I know you love so much. But we've cleaned up the language on that. For next year, we have MOUs in place. We have actual ties back to deliverables. So for this next year, I'm not worried about CTC stipends
So
at all.
this last year that ended
Mhm.
in June.
Right.
On the Communities of Care grant, there were some stipends paid
Mhm.
that it's not that weren't properly accounted for,
Right.
but perhaps weren't clearly designated.
Right.
And so as it turns out that when we spent that money out of the grant,
Mhm.
per the terms of the grant, they were not eligible expenses.
Yeah.
Is that a correct way of putting that?
That is, yes.
Okay, so we had to go through, as I understand, and figure out exactly how many dollars that amounted to.
Mhm.
And then the county had to write a check back to the funding agency.
No, we never went through with that invoice. So we've just resubmitted with the appropriate amount. So they
Okay, so
processed
we
that
just
now.
didn't,
We should be getting a
but,
check.
so it wasn't like we'd received the money
Right.
and then had to refund it. What it was is we were only allowed to request a smaller amount because
Right.
only a smaller amount was eligible. And the original amount was in fact, I'm just going to say the term, did not comply with the terms of the grant.
Right.
And that's why we weren't eligible to receive those funds.
Right.
Okay, but that was a small amount.
Yeah.
Big
I
to
mean,
me, but in
Right.
the grand scheme of things, small.
Right.
A few thousand.
So that amount, a large portion of it was taken out of kind of a mini grant account that we had,
Mhm.
and the rest will be taken out of the public health general, so public health reserve funds. We're spending down.
What funded that general health reserve?
So that is depending on it's probably some of the taxes, it's some of our foundational grants. So a foundational grant or some of the funding that we get, we can hold over to the next year. So we have 1 year to kind of spend it out in our accounting system here. At the end of that year, those funds have to go somewhere. So they can't sit in that same account anymore because it's gone and we're not receiving any more funds there. So at the end of the fiscal year for the county, those funds will turn over and they'll go into our general account.
Back into the general fund?
Into
Or
the
does it
public
go
health.
to the public health side?
Yes.
of it? So for clarification, and I'm sorry if I seem really dumb,
No, you're fine.
the county, through the mill levy process,
Mm-hmm.
general taxes that we receive, designate a percentage of that to the public health department.
Mm-hmm.
And it's around 90,000 a year, as I understand. Approximately.
Yeah. I don't
Okay.
have it in
And
front
the
of me.
total budget for the public health department is somewhere under $1 million a year, 900
Just
some
under,
thousand.
yeah.
So we're about 10% of that total. The rest of that money comes in the form of grants.
Yeah.
Okay. So when the public health department receives money from the taxpayers,
Mm-hmm.
is that money designated for specific function inside the public health department? For instance, the public health director's salary or a nurse's salary or
So
whatever.
those are unrestricted funds.
So they're just lost in kind of a mix.
They need to be used for public health purposes.
Right.
For our,
But
our
when you
core.
get grants, the grants are very clear. This
Mhm.
money has to be spent on these
Most of
items.
them.
Very specific, right?
Yes.
So if I understand you correctly, and I know it's a hard thing to answer in a concise manner because it's very complicated. But if I understand you correctly, if there's a screw up on the grant side,
Okay.
okay, there is potential that the taxpayer funded side may have to make up the problem on the grant. Is that correct?
So in theory, that would always be a potential. That's part of why we have a reserve. That's part of why the counties are eligible to hold some of these grants, is that we do have, have
Capacity.
reserves, we have capacity to handle those kind of issues. Where if an organization had CTC and that was all they had and that was all they did, and they had to go and find $8,000 or $15,000 or however many dollars, they wouldn't have a bucket to pull from. So that's part of how we function, is that that's here. Of course, it's a goal to not ever have that issue. We have plenty of money through our donation for this year to take that CTC. We had a donation of $37,000.
And where does that show on the budget?
I'm not sure what line it would be in there. It was during this year, and I haven't
It
gotten
was
to
like a
that.
foundation or an
It was
individual?
a foundation.
So a foundation just
Yeah,
unasked for.
Right.
Here's $37,000.
Right.
For unrestricted. Use it
Right.
for whatever you want.
yes.
Okay, so you could use it to pay back the $5,000, $6,000,
Right.
$7,000 that was a result of a mistake in grant management.
Right.
Okay. So, and how are these foundation donations tracked? I mean, how do the commissioners ever find out that happened?
So it came before you, at least as a mention, when it came in. There's not a signature required or anything like that.
Mhm.
The check did come in. It's being tracked, that part of the question. I have added it to our spreadsheet that we keep just as public health. And then it's also put into, I believe it's the foundation account up here. So that 37, it's in the account that Debbie has.
We're gonna find out.
I'm pretty sure it went into our foundation account.
Or a donation account or something.
I don't think we have a donation account. I'm not sure. But I think it was our foundation. Because it did come from a foundation.
And it was anonymous, or they did not want to be.
It's Colorado Health Foundation. They were, they sent some out to, I think, many of the different public health agencies. During this time. It's a difficult time. You've got to.
So this is like a
Through
COVID
COVID.
thing where everybody's struggling and
Yeah.
they just put some money out there.
Mhm,
We got $37,000 for that,
mhm.
and it was unrestricted. So I'm not picking on you. I'm just trying to pick on the process. So because we had an error in a grant,
Mhm.
that error occurred not on your watch.
Mhm.
We had an error in a grant. We took this free money and patched that hole.
We can. The money was going to come from somewhere. The money will have to come from
It
somewhere.
has to come from somewhere, either the county's contribution to this, or somebody just came in and says, I'll pay for it, or
Right.
here's some money and we decide to patch that hole.
Well, and the public health reserve fund, at this point is fairly unrestricted. So that amount we would still be able to pull from if we had to.
But it's kind of in a normal business world, while you may set aside funds to cover those oops moments,
Mhm.
you don't want to use them to obscure the oops moments because you have to manage to
Yeah.
try to prevent the oops.
Right.
And if you can just reach over here and take that money out of the savings account, slap it over here,
Mhm.
it becomes less noticeable. There's no pain, the perceived no pain. There is pain because we're taking money that should right here.
Right.
And putting it over here to just cover up mistakes. Thank you. Chief. And this
Right.
is the Colorado Health Foundation. So okay. Thank you.
So wherever those funds are going to come from, our process on how funds are spent, one of the things that I've talked to you guys about before is that we needed to move that just the signing of the vouchers, that needed to be something that the director is doing rather than anyone else in the office, because you do need to be able to double check and make sure that all of those expenditures are appropriate.
How's
and
it set up
reasonable.
now?
Right now, this moment, it's set up that way. So I'll be signing all the vouchers. And
So how was it
invoices.
set up prior then? Everybody signed their own
Our
vouchers?
office manager could sign for some of them, which she's not, as far as the math or any intention, she's fine. She understands what she's doing there. But the use of the funds for the grant purposes and intent and what's actually written into the budget, that's more appropriate for the director to be able to go back and check against, rather than the office manager, who has nothing to do with setting up these budgets or
So
communicating with the managers.
you get an invoice,
Okay.
a
Yep.
bill, whatever, and we're paying this out.
Mm-hmm.
You're saying that while the office manager may staple everything together,
Mm-hmm.
it needs to go to the director,
Right.
who looks at them and says, yes, this is, and
Right.
not only is it an appropriate expense, but it's being charged against the correct line item.
Right.
Okay. Then from that step, who does the final approval of those disbursements?
You guys.
It comes to the county commissioners.
Yeah. So
Okay.
she'll put together the vouchers. The director at this point will sign the vouchers. Haley brings those up, gives them to your administrative assistant, who then compiles them for the administrator to bring them in here. You all go through them.
So
then
we
you sign
receive a
off on the
summary
batch.
report. We don't see each voucher. What we see
Mhm.
is, well, I've got
The
one back here
batch.
about yay thick of all of the expenditures, vouchered expenditures that have been made across the county.
Right.
Okay. And so on there, we go through and we can see public health, and this was paid for this. And sometimes there'll be a note, communities of care, or tobacco cessation, or something like that, that tells us in general terms what the program is.
Right.
We have no visibility. We have no way to see if we've overspent,
Mhm.
if we're bumping up against the edges.
Right.
And I don't know if we ever get a report on a periodic basis that said, this is how we're doing. Do you know if we get that? I mean, I haven't seen one.
So generally that would be a financial report. I'm not sure what kind of format you would be looking for there. I know that getting into some of those specifics, the area we ran into trouble was in between one director to the next and kind of losing track of who ought to be in charge of what. So it is important that you're hiring people who you trust to be able to do those jobs, and then you're trusting them to do them. So reporting is important, yes. But you can't, it's not necessarily appropriate for you all to be in actually going through every expense for every program that amount of time. That kind of makes it so you wouldn't need a director or any of these other steps if you guys are just going to do the work.
I don't think we're talking
So-
about micromanaging, but at the end of the day, it is the commissioner's signature that goes on this.
Right.
So we're signing for the county. So you talked about confidence, somebody we can trust.
Right.
Okay. Understand this. We hire the right people. We trust them, but we still have to have somebody, whether it's three of us sitting here
Mhm.
or an administrator or an accountant, who can give us the overview saying, we're on track.
Mhm.
Everything's happening normally, or to find that time when we spent $10,000 on an inappropriate expense,
Mhm.
like we had that experience.
Right.
Okay. Somebody who catches that.
Right.
The reports that we receive, there's no indication that that happened. Okay. So
Mhm.
my personal philosophy is, as long as everything's going okay, don't monkey with it. Keep an eye on things.
Mhm.
But when there's a problem that emerges, and we had 2 or 3 inside the health department
Mhm.
on grant allocation, or how that was the money appropriately spent. Once we start becoming aware of that, now somebody has to dig down and see what's going on.
Mhm.
That makes sense. You would do it yourself with the people that report to you.
Right.
Okay, what's going on here? And we have a fiduciary responsibility to the county to make sure everything's working the way it's supposed to. And whenever we get a whiff that there's something wrong, then we are compelled to dig into it.
Right.
I think, Gene, you've indicated that approach to things too. And so stay out of the way, do your job. But if we find out there's a problem,
Mhm.
we ask that whoever made the mistake, come tell us about it.
Right.
Tell us how we're going to take care of it. What's the damages?
Right.
And what can we do legally to patch the hole?
Right.
But we don't want to have it keep happening. We want to, okay, we're going to come up with procedures so this doesn't happen anymore.
Right.
And that's really where we are. We're not down here looking over your shoulder at your desk, watching the vouchers come out.
Right.
But what's happened is, between overmanagement and no oversight, we've moved over to the limited oversight side.
Okay.
That's how it felt, because we couldn't get answers to direct questions.
Right.
How much money is there and where is it going? And this spilled over. You inherited some of that issue whenever you took this job.
Right.
And you sorted a lot of it out, and they're figuring out ways to make sure that we handle it properly.
Right. So that process, I think, is probably as good as it can be. So what we did is we realized there was an issue. We came and let the administrator know. And then as soon as I was able to sort out the issue and what our options were, I'm bringing it before
Here we are.
y'all so you know what's going on. That's all that is. Those are the processes that we can go through for that. As far as a report that we can definitely do spend down reports. And those are fairly simple. I think they may be more appropriate from our spreadsheet than from what you'd see from right now, the accounting software, just because the breakdown of what's where doesn't really make any sense. It's not really useful right now. As far as I understand, when we get the new system, it'll be much more useful. But right now we're at the end of the year. So that is going to make the report a little bit boring, but still something that we can manage. We could do spend down reports quarterly or whatever works for y'all. We'll just have to figure out what format to do something like that in.
But Gene, do you think that it would be good that we get some sort of, we're not talking about looking at the grant document and all the accounting paperwork, summary that says, okay, we're on track. We're at the 50% point and we're halfway through the year.
Mhm.
I realize it's not a 1-for-1 comparison, because you may spend a whole bunch of money in
Right.
at the inception of the grant for one time, like
Mhm.
workman's comp or something like that, where you just write one check for the year, those kinds of things. But we need to be able to track the trends. So it's more of a trend than a specific dollar amount.
Mhm.
We're starting to go red. I believe in what we used to call a Christmas tree.
Mhm.
You have a chart on the wall that you were monitoring, and green is good. We're not worried about that. Yellow, we better be paying attention to. Red means we got a problem. Okay.
Mhm.
And that's a very effective way of keeping an eye on things. So sitting at this level, we're not down there picking around in the weeds, snooping around, picking at things and taking up your time. But we need some threshold that says we just went red. Or we're in the yellow. We got a problem building here.
Right.
Now, when you're operating with grants, you manage them correctly, fine. But across the county, we need to be watching very closely where we're starting to move off our course, and we're getting into areas where it's going to cause us problems.
Right. I mean, that's what I'm hearing is actually a request for clearer communication,
Mhm.
because that's where you're going to find this issue more. And it's something where if your managers and your staff feel like they can come to you when they have an issue, that's going to make a big difference. And that's not something that you're going to be able to see on the paperwork. Because to be perfectly honest, if you're really concerned about how we're spending these down, the numbers aren't ever going to tell you the story you want. We can still bring a report. I have no problem with that. But it sounds to me more like what you're asking for is that clear communication and those lines of communication. And that's definitely something that is a request from both sides of the table, that communication issue needs to be addressed so that people can bring problems and can feel like there will be a productive solution to those problems. And then you guys can have the information that you need to move forward. And that's definitely work that needs to be done. And there are steps to take to make sure that's accomplished. Regular meetings for public health is definitely one of those, because this is a complicated department. And if you're not going to be able to invest the time to understand what each of these things does and why it matters and why it's important, then you're not going to be able to really respond to issues, because they're going to be too confusing.
But our argument hasn't been that we're not smart enough to do that, or we don't spend enough time doing it. Our argument's always been we have not been provided a lot of that information to make those decisions from. And I don't want to look in your book and see all those numbers. I just want to know from you, is there a problem?
Right.
You see a problem coming? That's what we need. That's what I think we need to know.
Yeah.
And
that's
that's what we've been asking for.
That really is. And it appears that there's been this, I'm going to use the term commingling. If it wasn't commingling of funds from one grant to the other directly, like taking money out of this bank and putting it in this bank,
right.
but a commingling of the expenditures. And it made it hard to track how much effort's really going into this program, because we're doing a timesheet over here, and this person's time has been spread across several programs.
Right.
That's an invitation for error.
It can be.
Okay. And to me, seems a little bit, you've heard the phrase, if you can't dazzle them with your brilliance, you baffle them with something else. And that's what happens. Can't get a clear answer, so you get all these convoluted bits, but we can tell there's something not right. And it turns out we were correct. Something wasn't right. And as a result, you've had to go back through forensically and figured out what happened and were these monies spent appropriately. And now you're having to go through and figure out what the damage is. If we didn't have to write a check, at least we couldn't request a reimbursement.
So we can, if that's the approach that we need to take.
No, I'm not suggesting that. I'm just saying what you had to go through and figure out how to take care of this problem, however we did. Okay, whether it was money that was misallocated, misspent. We're not saying anybody put money in their pocket. That's not what I'm saying.
Sure.
Is they maybe promoted their own concept of how to handle the money that didn't necessarily comport with the grant requirements. And as a result, we ended up with a big bank account, if you will, if I can use that term, in indirect charges, for instance. Or we were paying stipends for things that were not stipend eligible or not properly documented.
Yeah,
okay.
The amount was different.
And so it put us in this fuzzy gray area that we should never operate in.
Yeah. So the the overtime pay and the stipends from CTC, I would very much say that the turnover in public health was our big issue there, that it was very difficult to say that 5,000 versus 1,000 didn't fit in. That was a moment where there was confusion. And then the overtime pay, I don't know that the person who was making those decisions had the training or the understanding of financial practices or human resource practices enough to say that was the appropriate call or that was how things should be calculated.
Now, is that taking place in this office or was it taking place down?
It was in public health.
Okay, so you may have had the wrong person or inadequately trained person responsible
Without the
for something.
right,
But
yeah.
that's a management thing inside the public health.
It was, yes, and because I mean, there if we're doing blame,
It's not blame,
that's
it's
gonna
trying
be
to
very
figure out what the
difficult in
source of the problem was.
moment. But I believe that there was really a legitimate misunderstanding about how to calculate that. And it's the unfortunate part, the part that really matters and stings, is that what that left was that staff member is going to have to pay back some of the funds. And it comes out to about 500.
Significant to that person.
Yeah. And I think that's very difficult. It's a hard blow because no matter how small the amount was, we attach value to money that is far beyond the actual value of the money. So it's hurtful to say that we need to take money back from you. And that's awful. And I don't want to have to do that. But if we put our processes into place now, it's clear from top to bottom how overtime is charged and that overtime needs to be approved. Even though you all have approved overtime as a response to COVID, it still needs to be approved by that director position before
I don't want
they
to
go into it. So
you mentioned the term blame. I don't want to confuse blame with accountability. Okay, and if people are responsible at whatever level
mhm,
for doing something, and when they make a mistake or an error, we need to be able to drill down and find what the source of that mistake or error is. Now, if we try to deflect off of that or evade off of that and call it blame, which sounds like we're trying to assign blame to somebody rather than accountability, because accountability allows us to get in there and figure out how to fix it, whether it's
mhm,
training, whatever it takes. It's an oops.
mhm,
Okay, but when we have a pattern of oopses that keeps showing up in a department,
mhm,
now we've got to start looking who is responsible for that.
mhm.
All right, we did that, and but it's cast off as blame or whatever you want to do. No, it's accountability and responsibility, and our job is to make sure that the people who are responsible are held accountable. And accountable doesn't mean punished or disciplined or anything else necessarily. It means an appropriate and measured response to the situation as it occurred to make sure that it doesn't happen again
Mhm.
and that we can genuinely explain to the world what happened and how we're taking care of it. Okay, because they have a right to know. And if anybody cares enough to come and dig through all these public documents to find all of that, they could. We're kind of fortunate that most people don't want to spend their day doing that stuff.
Yeah,
Otherwise,
we'd
you'd be
need
answering
another
questions
person.
all day long. But I'm asking the questions now because I'm trying to get a clear picture of what is going on. And one of the reasons I'm so concerned is we have what I have characterized as a waterfall or an avalanche of money coming down
Mhm.
because of COVID. A lot of that money is for potentially duplicated efforts. In other words, you can use FEMA money for overtime. You can use CTC money for overtime, or you could use HCC money for overtime or whatever. And somebody has to say, this is how we're doing this, but we're not double dipping.
Right.
Okay, we can't double dip. But it's a matter of judgment. Where do we best take this? We now have what's called the Coronavirus Response Fund, I believe is the term for that, CBRF, which is probably the most liberal money, most unrestricted money out there. It's restricted,
Mhm.
but it's less restricted than this. So
Right.
we can actually do broader good with that.
Right.
Okay, the way that is structured right now, it is ripe for abuse. It's ripe for abuse. And the county is going to be responsible for how that money's spent throughout our county. It's almost $1 million.
Right.
And we have to really monitor it. And right now, and you've mentioned this, we need to have a plan in place.
Right.
So that the money is used to its best benefit and that we don't find ourselves in trouble
Right.
with the US Treasury later.
So yes, all of that is true. What we're doing for the funds that are coming into public health is we're tracking those in a similar system to what we've done before. So for this year moving forward, I made some aesthetic changes to the tracking system.
Mhm.
So it looks a little bit different than what Emily had before.
Mhm.
Her system was great. You can look through it. You can find where each dollar was spent
Mhm.
and how it lines up to the specific line item on each grant. So, but the change this year, the look is just that I've made them uniform from grant to grant, and that includes all of our funds that are coming in from COVID response. So
So it doesn't matter which grant you're looking at, it'll have the same format, basically
Yeah.
what you're saying. Okay.
So we won't have to go around and
Yeah.
see which one ties to the other one, and if we're calling somebody this thing and this one. So those are uniform across the board. So what we're gonna have is even for do you have a chat? Even for our unrestricted funds, you're gonna have that chart showing where we designated those expenses were to come from. So when we're vouchering back to those things that we're going to pay out from line items that are already in here. So we're not going to do necessarily the same system for that donation, for spending down from that, or for those funds that we receive from the state that aren't invoiced. That's going to be a slightly different process. But this individual workbook that we keep, and eventually the system that we're going to be getting in, will track what is spent to each account. So we're not just spending dollars in public health at this point that are unattached. So it doesn't have to be restricted, but when we put money out, we're still putting it into this workbook. Because you don't want to duplicate. The worst thing that can happen for us for public health is that we're going to have somebody come in and our books are going to be a mess and they're going to require us to pay back from somewhere or other. That's not what we want. So most of our response funds are going to salary. Most of our funds go to salary because that's what public health is. We're not creating a widget at all. So we're providing people to provide services. So that's what we're going to do. We track back to each individual account. So if you want to stop by even every once in a while, if you want to have a monthly coffee where we're going to sit and go through those workbooks just to see that there's numbers in them, I think that's great. Let's do that. But that tracking is part of that job. It's what it is. It's to make sure that when somebody says, well, how much have you spent from that foundation? You can have that information so you know. So we're tracking everything back that way. And then those can be shared with Debbie, although I'm sure you know when you look at two different systems that are trying to say the same thing, but they say them in different ways, that can be insane. But as long as our end numbers match my workbook to her accounts, we're pretty settled. So that's the goal in between those, and that's our tracking system that we're going to use. So it can seem that there is an opportunity to double dip, especially on those salaries. But what has happened is anything that I put into CTC, I have tracked that we paid this person's wage, their COVID expenses entirely from CTC. So those are done, they're gone. I'm not looking for anywhere else to put those expenses. So that's part of what I'm saying for FEMA or CVRF or any of the other funders, is that those funds basically don't exist anymore. We're not worried about it. We're not going to put them into it. And then some of them we're breaking them down by percentage, but that diversification is actually quite helpful for public health. So we want to make sure that our staff is informed across the board on these efforts that we're doing. So if we're going to say that prevention science is one of our priorities, and we're going to have an office manager who does not understand what that means, then we run into trouble. So we're not going to put 50% of the office manager into prevention, but we're going to put a portion of that office manager into prevention so that we know we can call on her to attend a meeting or a training or take handouts to a certain place and be informed when she shows up. So our diversification is not in order to dupe someone into showing that we're spending hours on things we're not. It is intended to make sure that we have a well-informed staff, that any member of our staff can go out into the community and they can advocate for public health, they can advocate for positive behaviors, and they know what they're talking about across the board. Some of them are more complicated. You cannot send me in a room to discuss TB. I don't know. But for the ones that we're actually including everyone in, those are more conceptual, larger, what is public health and what does it mean? So you'll likely continue to see that, because that's an approach that is pretty standard for public health, is we want people to know what it is and what we're working for on our long-term goals. So that is tracked by the number of hours people are actually working. That's why we break down our days into hours and grants, so that a person is actually tracking their real time. So we have had an instance where we needed to move some of the hours into something that the person wasn't budgeted in. So you have to figure out, if you're spending your time there, we need to budget you into that grant, or we need to move you away from it and put somebody else in. Those timesheets are a really useful tool for us. And we do use them to see who's using their time in what way. And you'll see, if you look at our timesheets, we actually have the percentage across the top. That's what you're expected to work over the year in each grant. So if you can get close to that, that's nice, but people rarely do. So at the end of the year, we're also able to say, you were meant to work, well, going into the year, we're able to say you're meant to work 50% in STEP. And I've only seen 15% so far. So as we're looking at our budget, is there a way to increase? Do you need more? Are you not interested in this program? Is somebody else doing the work and you just don't need to be in that program? Like, let's actually work through how we're going to use these funds best with that tool. So it's a frustrating tool to look at, and it's confusing when you're first looking at it, but it is useful for us. And we're able to make sure that we're not double dipping and make sure that we are using our staff in the best way possible by using that tool. So tracking, we're doing it. Do come see. That's also for CVRF. I completely intend to have a similar sheet where if we do have some proposals for projects, we're going to have those projects listed on there separately. If we do grants or some other allocation that's going to go to individuals or individual businesses, we'll also have a separate tracking system for that. It is important that we make sure that everything complies with the rules of whichever program we're using, and that tracking system is how we do that. We make sure that every dollar that's going out fits into something that we have already designated. And if there's a need for a dollar to go out that doesn't fit, we either change the designations or we find something else to help with that need.
Part of the CBRF, just an aside, while it's potentially part of, there's public health benefit there, potentially we could spend some of the money with it. It's probably going to be an economic focus.
Right.
So it may be handled separately. Now,
Yeah, it'd be a separate workbook.
You're in a separate, I mean, you're in a weird position because you're really our grant administrator. That's the position we put you in, acting as the public health director. So as grant administrator, you would be not only looking at all of grants you're looking at, and clearly there's a lot of work there, but the mini grant for the airport, the fog seal funding for the airport, which is a pretty good sized project, a whole bunch of things that probably haven't even come across your desk.
Right.
Okay. CBRF will probably be like those kinds of grants that don't have a public health focus.
Right.
Okay. That's moving into the economic recovery side of things. Okay. And we're not sure yet what how the county is going to respond to that. I'm concerned that I don't want I don't want confusion emerging around CBRF until we have a clear plan going forward, and that involves talking to municipalities that we're working with on this. And making sure. But I can tell you right now, one of the things I've seen is a lack of knowledge on the street about the availability of these funds for economic benefit. And it's not about blame or anything else. It's about a deficiency right now in that particular program that we need to address. It's not the program's got a deficiency, the response to it needs to be tuned up.
Right.
And so while that is a high dollar item with a very short window.
Right.
And we need to focus on that. And I know there's been a lot of confusion because of unclear guidance from the U.S. Treasury on what's eligible and not. So whenever you call the Department of Local Affairs and ask them a specific question, they go, we're just following Department of Treasury guidelines. Go read those.
Right.
They're not going to take a position on it because they don't know what Treasury's doing. They've got an idea, but we don't know.
Yeah.
Because we got conflicting information right at the beginning of this, what we could spend money on. And so until we have clarity on it, we're a little reluctant to do anything that could get us into trouble.
So we have our contract as of last week. I believe I sent it out to y'all.
That was with DOLA.
Right. So that's how we're going to get our funding. That's who we're invoicing back to anytime we spend funds.
Exactly.
And it does have our terms and conditions on there. And those are the rules, just like any of these grants.
Okay. Is there authorization in there to hire out of those funds a person to administer that program?
We do have some ability to hire
Some.
we do have ability to hire within that grant. We want to make sure, my intention is that we would be able to put our plan together, even if it's a rough plan and a quick plan, and then we make sure that we're communicating with Christy and Randy as we move forward. So as long as we're doing, and that's the plan with all of these grants, is especially if it's something new, you're putting your plans together, you're checking in with the program manager. That's their job. That's the connection, is you make sure that you're staying in communication with them and let them know what direction you're heading. And as long as we're doing that, then we're going to be able to say our goal is to hire a 0.5 FTE or to hire a full-time person to work specifically on the administration of this grant, if that's what we intend to do. And then we take that back to them and let them know what category we think it'll go in and how that will benefit our very loose deliverables for that grant, and make sure that that's something that sounds good, then we move forward. It's not going for permission necessarily, but it is making sure that you're communicating with the people who are ultimately going to say yes or no on accepting your invoice. And that's what we want to do.
That single grant is as big as your entire budget.
Yeah.
Okay.
Yep.
So we haven't worked that out amongst the commissioners and admin here.
Right.
But we're going to have that conversation. Okay, I'm sorry I've gotten you way off track. We've rabbit trailed all over the place.
You're right. So
you haven't gotten down to the public health director position.
Nope. One staff member is going to have to pay back some of that money from overtime, and the other one hadn't received money for overtime. So I did go ahead and include that memo, and just so when you see this come across your desk while you're signing, you know that that's why you're signing a check to these people or to that person, is because we didn't have all the information and didn't put it together in time for that final check. So it'll be in there now.
Thank you.
The public health director position, we went ahead and included that in the positions that you all opened Friday, and that's awesome. I will say that Sawatch has been without a public health director for, I think, 4 months now. We have quite a few public health positions that are open in the Valley, and in general, it is difficult to hire. So while we definitely want to collect applications, I think it's also important that we consider what's going to happen if we are not able to find a qualified person to fill that position. So that may come down to splitting duties between different staff members, potentially contracting with others. I think it's a conversation that we need to keep having.
And when do you want to sit down and address this issue specifically?
So I have some ideas that I would like to throw out. They do involve names. So I'm not
No, we're
really
not gonna-
comfortable
we'll
doing
talk
that at
about
this
another.
point. But I do think we need to do that whenever y'all are available.
Okay. We've been approached about other options
Mhm.
in other counties. Part of what we need to hear is what is one, skills qualifications required.
Mhm.
We need to hear salary ranges
Mhm.
that are representative of what happens in this valley. And are they competitive if we have to hire out of the valley? So if we have to go to Denver and hire somebody where they're making 150,000 a year.
Yeah.
And they're going, I'd love to come to the valley, but
Mhm.
it's not enough money. We need to know those things.
Right.
So, and then we need a clear understanding of when we have a job description, I understand, but a clear understanding of what we expect of that public health director. And that would start at what are the core requirements? What does a public health director have to do by statute? Period.
Mhm.
These are the responsibilities by statute. And then what does the public health department have to do by statute? And that helps figure out what your minimum staffing is.
Mhm.
And then as we look at these other grants, that other 90% of the programs, how do they relate to it and what kind of staffing? If a public health director is only managing, let's just say one other person, let's just say a public health nurse, they may not need the skills to manage $1 million worth of grants.
Mhm.
Okay. If, on the other hand, they're going to have to manage $1 million worth of grants, we need to make sure that we've incorporated that into what we expect.
Right.
And there's a possibility of a shared, through some sort of district arrangement, public health director
Mhm.
with individuals assigned to the various entities, perhaps.
That would be a very short. It would be a short-term option, and we'd have to keep the job open.
Okay, well,
If
it
we
might
went
be a
that way.
permanent fix too, depending on if you set up a public health district or not, outside the county boundaries.
Sure.
No, not leaning one way or the other on that. It's just on
Right.
the table as one of the options. And we've been approached about it. So that type of thing.
Right.
We need to have a clear picture of what it is we're trying to do and what our responsibilities are
Mhm.
with that function. And I think part of it is we had trouble because we inherited a public health district, or not district, the public health board
Right.
that wasn't constituted according to statute. It just kind of grown, people just added things on and
Mhm.
hadn't gone back to the book, state regulations, and said, oh,
Right.
this is how we have to do it. And so when we went back and did it as the book tells us to do it, it changed things up.
Right.
Okay, but we're complying now, whereas they weren't before.
Okay.
Those kinds of things. We want to know, make sure that whatever it is we do, one is complies with statute,
Mhm.
and two is tailored to what we need here, however that works.
Right.
And it may mean that we're going to run $1 million worth of grants a year for these various programs. I'm not talking about the merit of the program. It may mean we need to do it. Then we need to make sure that whoever we put in that position is capable of handling it.
Right.
Doing the right hire and that the communication takes place.
Right. And those are listed in your job description currently. I think the options and additional information, you may look for some additional narrowing down of your applicants or something like
Mhm.
that. As far as what they'll do on a day-to-day basis, that's definitely going to depend some on the person that you bring in and what their priorities are personally. This position is rather flexible in that way.
Mhm.
That if you're prioritizing health equity is your number one thing that you do, there's funding and opportunities specific to that. And if you're prioritizing prevention and that's your thing, then there's funding specific to that. So the position and the areas that it takes on is going to come back to some of the priorities of the person whom you hire.
What does
So-
health equity mean?
What does health equity mean? So depending on what we're talking about, we'll talk about COVID a little bit later and health equity around that. It's ensuring that people have fair and equal access. So fair and equal and reasonable access to the same information and services across the board. So
That
we're
can mean any
limiting-
number of things, whether it's language barriers or
Right.
whatever. Okay.
So it is one of the things that we're going to look at for COVID specifically for our area is we do have a significant portion of our population who are over 50 or 55 years old, which is its own designation as far as the risk around COVID and also around the availability to get to medical services, to get local information. A lot of our efforts have been through Facebook or other things that people aren't necessarily using or connecting with. So we want to make sure we're opening up our communication to get to whichever marginalized populations in the best approach for that population.
So on the public health director side, basically it's, yeah, we need to fill that position and it may take some time to find a qualified person who's willing to take the job.
Yeah. And we are required to have that. So we'll need to make sure that we have a good plan in place, even if we don't get applicants for that.
So that might be, like you said, assigning 2 people to do
Dividing up the
dividing
responsibilities.
responsibilities. And we have to
Yeah.
talk about the compensation side of that if we go
Right.
that route. Okay.
Did you want a break?
Yes.
You
Okay.
may. Is that what I'm hearing?
I'm fine to take a break, to take a quick break. Yes.
Yeah, we can take a break
All right.
and we'll reconvene. And then you've got 6 things down here, the last being CBRF, which you
Yep.
kind of already touched on a little bit.
Yeah. And we
Um,
can move them around. I'm not worried about that.
Okay. And some of these are fairly short.
Mhm.
Public health updates an hour.
That's our programs. Remember? That's
I
fun we were having.
mean, I'm going, I didn't know if it was an
We'll see.
update like what happened today or.
Yeah, It's
Okay.
been a long day. It's fine.
The communities of care, we've talked about that a lot, but you've got some specifics in here, some of which involve individuals. I'm assuming
Yes.
that may not want to be
Right.
conversation.
So that's kind of the problem with the work sessions that hopefully we'll discuss some more is it is a little bit difficult to bring some of the ideas.
In that
and
instance, and I don't want to
suggestions
keep you from getting where you need to go, but anyhow,
forward.
those things we can set aside for either a Board of Health meeting or a Commissioners meeting.
Mhm.
And if there are things that need to be discussed in executive session because they involve personnel, things like that, we
Right.
can do that.
Yeah.
Also, we can have an administrative meeting.
Mhm. Yeah,
Commissioners,
I think that
department
would
heads,
actually be best. And I suppose.
And we can do
talk
that.
to Suzanne about what that looks like.
Suzanne Benton.
Right.
You talk to her and we'll figure out the best format for dealing with that.
Yeah.
Okay, so you don't have to sit here and
Going around issues.
talking around
So
the issues
okay.
because of privacy
I just need to
requirements.
move a
Yeah.
little bit.
Okay,
All right.
she's in there.
At your request, that you can sign her. Oh, yes. basically what this is our leasing company that we have piloted the invoice. About this right here.
So this is the lead.
Yeah, we're calling a leasing company to pay pilot for the invoice.
I understand that.
Well, leasing companies, we owe money. Like a loan.
It is a loan, and they're not responsible for the performance. Once we borrow money, how do we go back and find it?
That's why we talk about it. No, it'll work out. Like car, you got the car ready, you have that lease agreement signed, or?
So if they tell you you bought this, you have a claim.
It hasn't been for COVID.
Same thing.
I agree, that's why we booked it. That's why I want, I wanted to move forward, but I don't want to get behind and pay all this money already.
I agree with you. That's what my dad said. Sometimes those baseball bat.
In the dark alley?
Okay, I'm
You know, all
signing
those
this.
boxes. They've already, they're from our services for us, so.
Did we get our money?
Or getting close. That's a Carolina Keller, what's it? Oh, God. I don't know, I'm hoping it's the end of the month. We have it back.
That's a.
You want to do it. Like I said, I don't mind doing it here today, but I'm not interested anymore.
That doesn't work. But whenever you can have private board, that's right. Oh, yeah. That's why I had to.
No. That's why they moved up.
What is this stuff?
I've never spoken. Well, I've gotten, I just from their building department is all I've never talked to them about.
Michelle.
Just haven't,
Don't have the heart.
not spring it down yet. I like her smiling face.
I understand that. I know you get a lot of stuff.
Over the last, for this year?
Yeah. One will show you.
All right.
Very exciting. The fancy system.
As far as I know, I have to look at the
Perhaps.
You feel happy.
Okay, I just gotta knock through my list. No, it's fine. I just gotta knock through my list. Were you all doing lunch?
Huh?
Were you all gonna do a lunch?
We haven't talked about it. What do you want to do?
I really don't care. I'm fine either way.
What works for you? Are you getting hungry?
I thought that was me.
Randy, you ought to know I'm meetings. But no,
You might be.
I'm not. We're getting so much misinformation from all sources
Mhm.
and assumptions. And what have you. And I want to make it clear. This is what we're doing. This is what we found.
Right.
This is what we're doing. And whether there's some spillover from the HVCC
Mhm.
crap that landed on you, giving you the opportunity to see it.
Yeah.
Okay.
I'm here. Yeah, I'm not worried about it. I just want to make sure and get through. And I think
I think we
I
can.
think-
I don't think it's straight. I think we got through it.
we'll talk about some of the meetings and the structure and how to go forward with Board of Health meetings too, because I think there is usually some sensitive stuff that comes up in them. So I don't know how you guys all want to do that in the future, but
No,
Suzanne's
I'm not
in
even
there,
sure
so we
what the
wanna
terms
keep it.
are. And if we had Ryan,
You're
to
not.
ask you some questions.
You're required to have public meetings when you may be making a decision. You're required to allow the recording when you're having a public meeting where you may be making a decision. But Suzanne can go over all that with you too. She
She's got
knows
it. She knows it.
she knows the statutes like nobody's business.
She does. I'm fine with that. And I
Yeah.
would just assume, I mean, it's not that I'm trying to hire anybody person,
Right.
but you can't allow these weird little rules,
Mhm.
which may or may not even be a real rule. I think that's part of the problem. It may not be a rule.
Mhm.
So we got to function.
Right.
And if we have to be able to talk, we got to be able to talk. Okay? You need to be able to say what you need to say.
Right. 'Cause this is-
And not to do the talking.
Mhm.
We'll figure that out. She knows the rules. One of the things before she goes to Arizona is we'll have her write down, tell us what the rules are.
Right. Well, I mean, there's a book of them.
Okay. I'll
The
read the book
CRS.
if I know where it is.
The revised statutes. That's all it is.
Okay, we're back to business here.
I can't see Suzanne. I had to turn my
What's
Zoom
that?
off. I can't see Suzanne, but I'm gonna guess that she's still there.
She's up here,
Oh, good.
but she's not, her face isn't just with a little muted X, okay?
I won't take it personally that Suzanne didn't come for my super long, entertaining meeting.
Well, we made it entertaining. So we're down to
All right.
2.
Hey, look at us moving along.
This is the longest half hour.
Hey, that was an estimate. I won't say anything more than that.
I'm sorry, but we actually covered quite a bit of
Yeah,
stuff. in there
yeah,
that was
right.
on the list.
So I actually might extend our break a little bit. I think it'll be best if I can have somebody print these job descriptions out for me. So sorry about that. I'm gonna go talk to Bobby real quick. What do you mean?
You're taking a lot of notes here. What'd you do as your first page?
It's
gone.
under here.
Okay.
Moving Nancy Molina.
And it's, we're really, she said that Suzanne in here can give us some good guidance on how we conduct the Board of Health meeting stuff. On, there's a lot of sensitive stuff that comes up in those meetings. So. I find it interesting, Julie.
Thank you.
Our
Did you
bidding,
want to ask her about that now?
if
The meeting rules?
it's convenient for her,
I can ask her.
if, you know,
We're waiting on the printer anyway.
printing, or not printing, estimated purchasing requirements. That's essentially what you were doing before. We have the option of buying local.
Okay, now you can answer
for
that.
percentage, right? We want to support the local businesses. Okay.
Yeah.
So I'm going, this stuff doesn't have to drag on. If we have the money in the budget somewhere, and we're mixing and matching like crazy right now in terms of having to do a supplemental because of all this changes. Figure out how to get it done. Particularly if you can do a twofer. I don't know if you can.
Yeah.
But
Well, normally it would be under normal circumstances, it wouldn't be so bad because a lot of times if you got somebody that knows what you're looking for, they'll send somebody specifically to an auction, for example, and try to buy 2 of them while they're there and then be done with it. So, but that's why I was saying you almost have to be ready to.
you can't wait around for the next meeting. If we're taking them now.
Mm-hmm.
You have to get careful because that one commissioner bought the road grader or whatever, bulldozer, ended up buying it.
I never forgot that story. I heard the first meeting I was at Dennis Hunt with.
All right. Well, it's good to know.
Yeah.
But we don't want to get to the point where we just hide down and can't get anything done. So know the rules. Play by the rules, win by the rules. And that was helpful to hear that. Got it. And what I wish is I had a good, personally, clear understanding of where we are on the budget, which we were quite sure, Like, okay, let's just say the department so-and-so over there has $20,000. It's going to they're not going to spend. And we could use that to buy a vehicle right now that we need right now. Okay, that's what we're doing. And we're going to move it whenever we move money. Budgets whenever we do it. I don't know what's going to happen if the COVID virus abates and we try to move back to some sort of normal function. I don't even know what that's going to look like, and I don't know what's going to do to inflation. I'm really concerned about it. So I'm looking at like if we can buy stuff that have long-term value to us right now, probably better off getting it done as quickly as we can.
Yeah.
Whatever that looks like.
Yeah, and interest factors being what they are and everything else, as they said, that we don't know what that's going to do to them. So
I can go crazy.
Yeah.
Remember the Carter years?
Mm-hmm. I do.
We could find ourselves in deep doo. I don't know. But it's like I'd like to have a TV on the wall back there. But is that the best place to spend our money? It may be, not the best place, but it may be a place that's appropriate and we have the money available for it to buy. I can't figure out a way to buy 2 vehicles under COVID.
That might be tough.
But if we can supplement other areas of expenditures, whatever, CBR or whatever, free up that money. Right now, we're sitting on a couple $3,000 worth of OWL systems in that box.
We can do all that through COVID, right?
Yeah, this stuff's paid for out of COVID, if we accounted for it. Yeah, and the TV would be paid for out of COVID. Any of this stuff, right? Like if we hire let's say we hire somebody to manage the CBRF fund. Well, there's going to be other expenses related to that position, like buying a desk. Not that we want a bunch of desks sitting around not being used, but something like that, the office equipment. If we can make it specific to that. And if it's something we can use in the future.
Yeah.
All we have to do is have Dan Hicks come in. Figure out how to spend that money.
Yeah.
Well, he's sharp.
I'm surprised we haven't got more application thing.
I don't think people think about it. You know, and I was talking to the cleaners, Sparkle cleaners. And I don't know if they're how bad they've been. He told me, you know, that a lot of their summer money comes off doing the industry sorts up in South. You wouldn't think that Monte Vista, South Fork, they do. And they said they've lost a month. They're a month behind. They're lost because of this, and it's not going to be added on the other end.
Right.
And she said it really had an effect on them. And I said, "Were you aware of this program?" She said, "No." And I said, "I want you to call our admin." I said, "It's going to be, we're just in the middle of putting it together." I would have said call the city of Monte Vista because inside the city had their own program. It'd just be, but I didn't want to open that kind of one. Just so.
Yeah.
But I'm thinking it's people like that, that, you know, you're on the street, you're at the restaurants, or wherever you go do your business. And you can kind of sense that they're struggling or whatever. It's a bad deal for them.
It would be really nice if the towns were doing that because then that'd give you another set of eyes on the process too.
Mm-hmm.
They'd be looking at it, scrutinizing it pretty good before it got to us even.
Mm-hmm. So, but I personally don't want to see it get shuffled in with all these other grants. That's why I'm trying to get Suzanne Benton into. She's got a clear head on things. She can see this stuff a mile away. And she's basically saying the same thing we were saying.
Mm-hmm. Yeah, I was so tickled when she decided she'd do this.
It was a good call. I'm glad you thought of it. I really am. I just had written her off saying she'll never touch it. So I was praying.
I really sweated it when she didn't come back that day. She was supposed to. Oh no.
I think she's kind of excited because I think she can see she can accomplish it. It really makes a difference.
She stepped into the restaurant.
She can make a big difference for the county. She'll make a big difference to the county again. It's just a weird thing.
Okay, is she tied up?
She'll be with us in just a minute. She's trying to send an email.
Hello.
Joy.
She gave up on her email.
I couldn't get it.
You're here to tell us how to run public health. Right?
A public meeting, yeah, a commissioner's work session.
Well,
Well, we kind of covered that earlier before you came in a little bit.
Oh, good.
I really think if you're just getting information from somebody, like, you know, Tony and stuff, you can call it a work session, just a meeting with the department head. You don't have to do that on Zoom or anything else.
Or have a public hearing.
Yeah.
What we're looking at, particularly in the Board of Health meetings, it's really hard to segregate out sensitive information, particularly in a situation like that.
Yeah.
And so we're trying to figure out how to structure our meetings so that we can talk about what we have to
And then
and
just, you can just say the meeting's closed and then go to a work session. You don't even need to tell them, just say, well, the Department of Public Health Board of Health is now closed, and then just get off Zoom.
just adjourn.
Yeah, and then you can still sit here and go through stuff. You can't make any actions, but just getting general information and stuff, you don't need to sit there and do it all on Zoom. And the only problem is now if Suzanne wants to get in, you'd have to set up a private Zoom meeting if one of you weren't here.
Well, we've done that before, where we've had executive sessions on Zoom before we were all showing up in the office.
Yeah, and I wouldn't call them executive sessions. I would just say, you're gonna have a Zoom meeting because it's not a meeting. You're gonna have a Zoom work session and let it go, and it's just, that you have to be invited in to go to it.
Right.
Joe Q Public couldn't go in. You'd have to host it and then just do it.
So I could be in my motorhome in Arizona and do all this.
Yeah, that's the way I do my bank board.
Yeah.
We have We have a private Zoom line. Until then, we had a private phone number I called in on, and I had my workbook that they download stuff on, so I didn't have to be there.
That's great.
Yeah.
Take advantage of technology. So
Okay.
we're concerned about the public health side and specifically being able to just,
So just to be as open as possible and keep the meeting open, if you guys wanted to talk about half of the COVID-19 response and the tobacco part, I think that would be perfectly appropriate. I don't care who's listening. But for the other points on here, I think if we could just
okay,
discuss with the commissioners, that way I don't have to
we're
be
talking about right
worried
now,
about saying names.
we're gonna talk
Yeah,
about,
yeah, if you have general information, you're just giving it to them, go ahead and do it
Yeah.
on Zoom. Then if there's names or
The
Fine.
positions are specific, yeah.
specific, then you can just have a work session. And then if you decide to put out a notice or something like that, you can still do that. It's just afterwards, if you have to hire or something like that, you have to do it in an open meeting.
sure,
But it's same thing as having an interview with an applicant or anything else. You're not gonna do that on Zoom. You better not.
no,
It becomes an issue.
so item number 2,
I'd like to move that off of Zoom if you all don't mind.
okay, can we do 3 and 4?
We can do part of 3 and all of 4.
Okay, and then number 5 would be also,
Yeah, it wouldn't matter, but I would like to do that at the end just because that's the one I'm easiest to squeeze time out of.
okay, so we're moving on to number 3. Do you know what number 3 is?
Yep.
It's a test.
Yep. Got it right in
Okay.
front of
Is
me.
that it?
Yes,
Thank
thank
I'll
you,
see if I can
Suzanne.
get that memo sent.
You've got this.
Thank you.
Okay, so you have in your emails links to the school reopening plans
Uh-huh.
and the outbreak response for schools. This is a big concern for the public health regional effort, and it relates to the Protect Our Neighbors in a couple of ways. So one thing that you would see in that 3-phase guidance link is that the school's expectations for opening, so the guidance there, obviously not a rule, but expected kind of guidance, really is dependent on where the county or region is on those phases. So are we still at stay at home, or did we move on to Protect Our Neighbors, or safer at home, which is where we are right now. So their expectations for opening kind of went back to what phase we were in. And our schools had a variety of responses to that guidance and had different plans for opening. There's a lot of effort going into providing really quality online schooling. I think that's awesome. In the outbreak response, what you're going to see is there's a lot of responsibility for public health to continue doing what we're doing, but it's also complicated because some of our contract tracing and some of our work is going to potentially be taking whole groups of children out of the school. If they are cohorting, then that would mean if
Cohort would
somebody,
mean what?
it's a similar group. So if they
Okay.
have a group that they're going through the day with, and somebody in that cohort gets sick, so there's plans in here that go down through each of the levels. So if one kiddo got sick and other kiddos weren't in direct contact with them, what do you do? If one person gets sick and the other people are in direct contact with them, what do you do? So public health is going to be involved in a lot of those steps.
Okay. So the schools typically early on were kind of operating in their own little world through the Department of Education.
Last year,
No, I
When
mean
COVID
during
happened.
COVID, last spring.
Yeah.
Okay, and now if I hear you correctly, public health is going to have a more active role in this reopening.
so we're going to take the role that we have kind of in the community and we're just putting it into the school population. So we're going to be doing that contract tracing, outbreak reporting. That would be on us. The school's also actually required in that to report any outbreaks to the state. That's just to double up and make
How
sure.
does the school find out?
So there were some concerns about HIPAA and the exchange of information, but we've actually, in the guidance here, we've got permission to share that information. So the parents can self-report back to the school, and the school can report to us if they have somebody come in and say that they were positive. but we're going to get that same information from them. So in the contract tracing process, what we're doing is we're getting in touch with the people who were around the positive person. So we would be doing that same kind of idea with the school, and that would involve the teachers and anyone else who was in the room at different levels depending on what their contact was with the student. So basically this is going to be, we have some guidance that is allowing us to plan. It's also going to be fluid, I would anticipate. But as we see what the actual effect of returning to school is, our guidance may change. It may grow. We might see that it really is just pretty safe. And as long as you're following the guidelines, we're not going to have a lot of outbreaks. It's entirely possible. So we really don't know what going back to school is going to look like. This guidance is fairly broad. It leaves some room for the state to come in through CDPHE or the Department of Education to make some adjustments as we start getting numbers in. But just so you're aware, we do have these, and I went ahead and included the link for the guidance for both so that you have them and you can refer back to them if you have questions for yourself, or if you have people asking you questions, you have the actual documents that are guiding our advice when we're reaching out to people. So we have that. We have had our approach for masking is going to be similar to the approach for the school guidance, which is that if we find that someone isn't following the order or following the guidance, we're taking that encouragement approach to provide the information, let them know that these are the expectations. Everyone seems to be very aware that there was an incident in Alamosa County where public health worked with law enforcement, is my understanding. The only people I haven't heard about this from is the public health department, because I haven't asked, not because they're not forthcoming or anything. So that's my understanding, is that there was one highly escalated episode where people were just completely refusing to comply, even after being instructed to comply. And that's brought up some questions in the community about what are we doing with enforcement. So there are quite a few people who are asking what we're doing with enforcement. There are some who are asking less nicely than others. But I think it is important that the Board of Health take some time to really consider what our enforcement approach is, or what our approach is to ensuring that people are complying with orders. And I'm not going to say what that needs to look like exactly, but I do think that it needs to be more than just me or Ida saying, here's what we do with a masking issue, or here's what we do with a school that throws a bonfire. What are our steps? So I'll provide some additional information as I get it. I believe there will be an update to that too, but I might be wrong. There are forms now to escalate to the state issues of compliance. So we need to research those and see what that would actually mean. As you've seen, usually if someone's going through, it's more of a licensing issue. So you'll no longer be able to keep your doors open if you're allowing people in without masks. That's
The
kind
state,
of the issue.
because the state provides, we have the state licensing.
Mhm.
DORA takes care of that. I'm curious how Weld County is dealing with this, because they've been an outlier and basically told the governor that your orders are unenforceable and we're not going to enforce them.
Right.
I don't know, that information is 2 weeks old. We don't know what's transpired since. I don't know. Have you heard anything? And maybe the governor's going, I don't want to go there because there's questions about how long can he have an emergency order without the legislature coming in and actually making a real emergency order. There's all these legal technicalities which will not get resolved right now.
Right.
So when we have this issue where the state can come in and say, okay, your hair salon, your restaurant, whatever requires state licensing, shut down. But if somebody, let's just say a church, just blatantly defies the recommendations, and we want to enforce the rule.
Right.
What license is going to be taken away?
Right.
There is none. So your enforcement is limited to basically calling in law enforcement,
Mhm.
which probably is not practical, if even legal at this point.
I'm not sure how much cooperation we would get.
Right. Well, even if you had the cooperation, let's just say that you had a police force that was willing to do it.
Mhm.
I'm not sure what the legalities are, because we've never gotten clear legal advice. We hear all sorts of different experts tell us.
Right.
But nobody has actually said, even from the governor's office or the attorney general's office, and that's really where it should come from, these are your authorities when it comes to enforcement.
Yeah, we've never had
Nothing.
from anybody.
Zip. And so, you know, one of the things we said to public health directors is you can pass all the rules you want. You don't have arrest authority.
Right.
You have to rely on law enforcement to do that for you. So it's one of those.
And would we, even as public health, recommend that it goes to that level?
It goes out, but
Right.
let's just say it's a blatant, flagrant violation. It's just pure defiance. Pure defiance.
Mhm.
Okay. And in the instance in Alamosa, I think somebody wanted to make an example of somebody, and these people made it easy to do that.
Potentially,
They just
yeah.
stepped out there and put their chin out and got hit. And the state can shut it down. They've got the same thing going on with the gymnasiums on the East Coast, where that one gym refused to shut down.
Mhm.
Okay, we pull their license. We're not shutting down anyhow. We're never going to be running their gym in the jailhouse. Keep that.
Okay, so I'll
So-
reach out for some additional guidance around the actual legal advice around enforcement. I will do that. And I think what we would need to do is just continue the conversation around how the Board of Health, maybe official statements or official stance on certain things, just so it's not our department.
You don't
The
want to take the
individuals
heat.
within
You
our
want us to
department.
we're already taking enough heat.
Well, kind of. I just want to make sure that it doesn't appear that I'm saying this is how we're doing the masking. I think that's important to be an official decision that's made, and it's not my opinion on masks that is really deciding how we move forward. Rather, it's the Board of Health.
Well, and the Board of Health does something like that. They need to have good information, consistent information. I'll cite as an example headlines this week that wearing those gator masks
Mhm.
and or bandanas is actually more harmful than wearing no mask at all.
Right. I did see
Okay, and that came from some study done by somebody.
Mhm.
Okay, well, we don't have the capacity to go track down the truth, all of these deals. So that
Right.
has to come from public health, I mean, from the professionals.
Right.
And whether it's the state, regional, or you,
Mhm.
that can say, yes, this is a valid point.
Right.
Okay. And part of our challenge is the public has no trust in what they're hearing from any source because they've gotten so many conflicting and mixed messages from day one that all they do is it's like the weather in Colorado. You wait 10 minutes, it's going to change. And so they don't have any confidence in it. So if something like this comes out, let's just say it's gators and bandanas, we would look to you rather than one of us
Mhm.
to check it out. Is this the truth
Right.
on it? And then you can come back to us and say, okay, checked it out. A study at the university of whatever says this. This is our recommendation. And then we have something to go off of.
Sure. So specifically on that kind of issue, we can definitely dig in a little bit farther. I think maybe my approach would be to send you guys the rules and the guidance and maybe a draft of if the Board of Health were to make a statement, would we want A, B, or C? That's for how we'll move forward on our approach to enforcement. And
But our data has to be good because right at the very beginning, I still remember February 26th when I said, do we have masks?
Mhm.
Masks don't do you any good.
Right.
That was the advice we got. Okay. Okay. Why? Because, and they explained.
Right.
Okay. Well, and we went back and forth on it about, well, even if they leak around you
Right.
and you might get the bug, at least when you sneeze, it's not going to be as widespread. argued about that for a half hour.
Right. And there have been changes, and there's been additional research that's been done just during the time that we've had COVID, and we've done, there are numerous articles, but I can send what I have in kind of an approach to a statement and see if that's appropriate for the board, to also kind of absorb some of that authority to say that it's not a single person determining this, but we're really taking it to a
Well, and actually the mask order, that's the governor.
right.
That has nothing to do with the Board of Health, the commissioners, or you. That is what the governor's order is for the
Right.
state of Colorado.
In our enforcement around that, I think is the question that
Well, and they've
bringing
answered
us
that
up.
question by saying it's up to the businesses. We're not talking about
Mhm.
state licensing, we're talking retail.
right.
It's up to the businesses to enforce. And if they choose to, they can use the trespass option to bring the police.
Right.
Okay, and that's really how it should be handled. Otherwise, we issue an order from the
No, I don't
Board of
think we
Health,
need an
and
order.
it's like, we can't enforce that.
No, I don't think we need an order. for
And
anything.
I'm finding, it's my experience out there in the public, that peer pressure,
right.
and I don't mean in your face peer pressure, but
Mhm.
just pure peer pressure, as people become more confident or more comfortable with the accuracy of the information they're receiving, they are saying, well, I'll just wear a mask because
Right.
it's what everybody else is doing. And I think that's working
Mhm.
from what I've observed. And I don't get out a whole lot in stores or what have you. But even in my
Yeah.
church, people will mask. And then they may take a moment to get them scattered around, and we're not overloaded with people. But I've noticed that, just a kind of a
Okay.
change in public attitude.
Yeah. So we can include all of that in there and see what y'all think. And I'll start sending that out. I also wanted to bring up the current variants that we still have.
Mhm.
I did talk to Ryan about this. So point to point, we are really more restrictive than the safer at home at this point.
We are,
Yeah.
but
And
we said
it's
that
not
if the
being
governor,
enforced.
it
Yeah.
was the governor's deal. So we're just restrictive unless the state relaxes the standards.
Right. So my question is, if you all decide to, whether that variance is necessary at this point, or do we want to just go along with the state? Do we keep that on if we're not enforcing it and none of that is?
And talk to Ryan, but right now, let's just say he went back to stay at home.
Mhm.
This is more lenient than stay at home.
It would depend on the conditions and if those variances are going to change with those conditions. It would be difficult for.
But if we have this in place, they're gonna have to take it away from us rather than have us give it up.
Potentially, yeah.
Okay,
And if we apply for Protect Our Neighbors, we're also likely, they're clarifying, but we're likely going to have to get rid of the variance in that process
well, it'll be a new variance, right?
if we were awarded. It would just be that new status. So we would be in Protect Our Neighbors, but we wouldn't have a variance around it.
Oh, we'll have to look at that and we'll see
Yeah.
what it means. But right now, this was kind of this set the floor. And if the governor, if the state relaxed the standards
Mhm.
to be less restrictive than what we had in the variance, we had it. But if they started tightening up again, we still have our variance until they come and tell us we don't.
So that's
What do you think,
completely
Jane? Is
fine
that-
if y'all decide that that is what we want to do to keep it. But I think we want to make sure that we're not confusing people as much as possible, that we have this order out in place, but that bit of information in there, which Ryan did point out that we wanted to go with whichever was less restrictive.
It's very clear in there.
Yeah, so we still have the order and the points in the order, but it can lead to some confusion. So we can keep talking about it, or we can leave it as it is. It doesn't
Well,
really affect my day-to-day.
I
at this point.
don't trust enough stuff coming out of up north to drop our variance and then not be
Okay.
protected myself. That's just,
I agree with you.
I would feel more comfortable knowing that at least we're protected at our level if the governor changes all of his,
Okay.
whatever.
You know, you understand all the confusion out there.
Yeah.
And the divergent opinions. All you have to do is go on Reopen the San Luis Valley, or you go on another one of those Facebook sites, and you can
Mhm.
see. And what I've been telling people is when we have the information, we take that information and use it to help guide our decision making so that we come up with a measured and proportionate response. Okay. And just because Denver or Broomfield or even Saguache County has a problem doesn't mean, depending on the situation, doesn't mean that Rio Grande County has a problem, even though we're adjacent neighbors. It depends on what's happening. And we have to look at it like that, and this blanket, gross, generalized numbers don't help us.
Okay.
And we're trying to do it. We're trying to make sure the economy functions as best it can under the circumstances. It's not the economy at all costs. We don't want to see dead bodies out there just to protect the economy. On the other hand, we don't want to see a dead economy because we're overprotected.
Right.
It's a balancing act. It's a tough decision. We just have to make sure we have good information. And right now, our variance is working, and the state orders.
Yeah,
State.
I mean,
It's working in this county. We'll see what happens when school starts. But even if school starts and we have a problem, that doesn't mean we have to shut down the RV park if the problem's in the schoolhouse.
Right. Not necessarily. It'll depend on
The circumstances.
Yeah.
But we take this, oh my goodness, you've got this vague outbreak somewhere, we don't know where, so we're shutting down everybody.
Right.
When it's isolated to a specific unit.
I don't think it's going to hurt anything to keep it open. I think it's potentially confusing to people, but so far everyone's just going along with the state guidance anyway. So we're definitely not.
Well, anybody that asks me, that's what I tell them to do.
Yeah.
What the governor says, that's what we're going by.
And that's
And
where
then
we
that-
are right
that
now.
Clears it up as much as you can. And I don't know how else to, I just don't feel comfortable giving up a variance enough to do that without the coverage. So
And if confusion is a metric, tell the state to clean up the message and the fence. You know?
Yes.
Okay.
So the variance is fine. The tobacco. Somebody unmuted. So this is just a summary, basically, of the upcoming changes around tobacco. A state license is going to be required for all cigarette, tobacco product, or nicotine product retailers beginning July 1st, 2021. So I don't know if this is the first time that we're bringing you this information or not. But this is also within the new tobacco retail laws and regulations. There are expectations for law enforcement or someone through law enforcement, so contracted or cooperating with law enforcement, to do checks on those licenses, similar to what you've seen with alcohol. So we don't have to do anything with this today. I just wanted to bring it to you guys. Suzanne, you'll see that as the Colorado HB 20-100, that attachment on your email.
Thank you.
Yes.
So what they're doing here is they move the minor in possession restriction out of it.
Right.
Raise the age to 21 and put it solely on the retail.
So it's
So
licensed.
the kids are not responsible.
They are not.
They can't be punished
Yeah.
for breaking the law.
So you're taking away that. You're taking away that punitive response to this issue. So just like we were talking about earlier with the school's response, it is documented. We have research to say that if you are going to try to actually change the behavior, this is less successful than going through a whole restorative program to kind of help instruct and divert the youth than to just punish the youth.
So we've been trying to divert and inform and divert. That's why we got these programs.
It's part of the effort, yeah.
Yeah. Okay. And apparently they've been so unsuccessful that we're having to do stuff like this.
So it's another level of response to the issue. This licensing is one of the parts that's going to complicate things is that in order to recover funds to use for those, the checks on the license. So if we're going to send out, if it's going to be a municipality or the county if we're going to send out an officer, for instance, to do that check, right now the licensing through the state isn't going to be the same. So we also need to consider local licensing. And that would mean that you would be able to collect funds that you would then use for this purpose. And it also means, of course, the administration of those licenses and the processing. So it would be similar. It's set up. It looks like it's pretty similar to alcohol sales. But it's kind of beginning. This is fairly early on in the process of what this is actually going to look like.
So this is state law. The county powers were authorized to license or otherwise regulate the sale of cigarettes, tobacco to persons under 21 years of age.
We don't want to sell to them. Nope.
But the law already says you can't.
Right.
So why, that's not county authority at that point. The state's already taken that, right?
So your licensing, it's similar with alcohol. You're going to license them to sell to over 21 as well. So that age restriction is part of the license. It is part of the agreement that they're making in getting that license, is that they would comply with that law.
County cannot enact a license that permits a legal age below the age of 21, okay? And then,
Those retail compliance checks, that's where you would need to be able to recover funds from somewhere to cover that cost of personnel.
but we don't have to, that's the Division of Alcohol and Tobacco Enforcement Authority of the Department of Revenue. It doesn't affect us on the compliance checks. Recheck for violations at the state, published list of retailers, that's the state, so we don't have to do anything there.
I just like this. I like, you have to be 21 years old to buy cigarettes. But you can be 18 years old to sell them.
That age
That's so you can
has
go to
actually
Jack's Market and
changed
sell
as well.
cigarettes,
Yes.
but you can't use them.
So that age, that there was no restriction on that previously. So that was
Really, the only thing we've got authority over here is to approve sale within 500 feet of school.
Yeah, and we will have additional information about coming out around this, just so you know. I wanted to give you an introductory look, so that you know that this is a thing that is coming up from the conversations that I have heard, which were pretty minimal. It does look like there's an effort to see some local licensing around the tobacco retailers. So the pros and cons of that, and some more of what the expectations will be coming out, I'm sure. So we'll have more conversations about it as we get closer.
Well, another
Thank you.
thought. Thank you.
No problem. Let's see what else we've got that is good for this. Okay, so again, not to hide anything, but the rest of what we're going to cover would be a lot simpler for me if it were.
Now, in the CVRF,
Yeah,
that's off. We're kind of done with that for today.
we're pretty well done with that, unless you guys had some questions about my plan, my approach for that.
So what we really have is some personnel matters under a couple of these items
Mhm.
and the public health update. Okay. I guess at that point now, we can log off the work session. We'll go into the administrative session, talk about these items. Okay, how do we make them leave the meeting?
We get Bobby.
Are you going to set up another Zoom so I can participate?
I think we might just be leaving you in this one. Let's see what Bobby
Yeah,
does.
you have to,
No, we have to
you
log
have to
off.
set up
You have to log off and start over.
another one for Suzanne only.
I just hit the end, but I didn't hit the end for all.